and I think it's a mixed meeting. Am I correct about that? Where there actually are people in the room this time. So
yes,
I'm not going to read all the rules. This is the 19th meeting of the House of Commons, the Public Safety Committee for the House of Commons, and this meeting is pursuant to a motion adopted on March 1st and subsequently amended on the safety and security of passengers required to stay in federally mandated quarantine facilities. As I say, it's in a hybrid format. I'm going to welcome the two ministers, Minister Haidu and Minister Blair, and they will introduce their staff as they see fit. And if I may invoke the mercy rule, which is if we could make the remarks 5 minutes or less. We are already an hour and a half behind where we should be, and this is a scheduled 3-hour meeting. So with that, may I ask either Minister Blair or Minister Haidu to proceed in whatever order they choose.
Mr. Chair, I think the decision was made that I would begin, so I will, if I may. Thank you, honorable committee members, for the kind invitation to join you here today. We appreciate your efforts to review the measures that have been put in place, particularly at our borders, to keep Canadians safe. I'd like to also begin, if I may, Mr. Chair, by expressing my deep concern about the very serious allegations of assault that took place at a quarantine hotel during a quarantine compliance check. The events that are alleged are criminal in nature. They must be thoroughly investigated. Perpetrators must be held to account. I can assure this committee that I understand that these matters are being investigated by the police of jurisdiction, and that our agencies, and particularly the RCMP, will provide support in that ongoing investigation as required. While I can't comment on specific elements of any operation, I'm joined today by Commissioner Lucky and President Osowski, as well as my Deputy Minister, Rob Stewart, to provide any additional insight members may require. But if I may, let me briefly talk about some of the measures that we have put in place. As you'll recall, last March, we introduced the mandatory 14 quarantine period for the country as recently. And recently, we have implemented additional measures and testing requirements for travelers arriving in Canada by both land and by air. All of these measures, Mr. Chair, have been implemented in order to slow down the spread of the virus, and we have put these restrictions in place to help prevent further importation of the virus and new variants. I'll briefly speak of the role CBSA plays in these measures. Since we introduced the requirement for travelers to show proof of a valid pre-arrival COVID-19 test, I'm pleased to tell you there's been an overall 59% drop in international travel by air. And of those international travels arriving by air, Mr. Chair, over 99% have been compliant with the mandatory pre-arrival testing requirement. I think that bears repeating, 99% compliant. I've been involved in the law enforcement business for a long time, and it's a very rare thing that we see that level of compliance, and I think it's a testament to the commitment Canadians have made, even those who are traveling for non-essential purposes, to keep themselves and their communities safe. To be clear, our actions, the health and safety and security, throughout all of our actions, the health and safety and security of Canadians has been our utmost priority. Our temporary border measures have been essential to keeping Canadians safe, and we continue to strongly advise against travel outside of Canada. CBSA officers in all of these measures have been at the very forefront of Canada's COVID-19 response since the beginning of the pandemic. I believe they've responded to the challenge, quickly adapted to new border and health measures, and have done, quite frankly, an extraordinary job in helping to keep Canadians safe. They apply over 90 acts and regulations in addition to all of the provisions of the orders in council established by the government to respond to the pandemic. And they share, clearly, our collective commitment to keeping Canadians safe. They screen all travelers upon entry. They're vigilant, professional, and responsive to the needs of Canadians. They collect contact information on behalf of the Public Health Agency of Canada. They confirm the suitability of quarantine plans for each traveler. And before any decision is made to allow travel to enter Canada, they review the traveler's unique circumstances, the purposes of the trip, and the documents presented. As designated screening officers, they have the authority to review, challenge, and confirm travelers' statements. And when any questions arise regarding a traveler's quarantine plan, they are directed to the Public Health Agency of Canada, who make the final determination. And once the traveler is then admitted into Canada, the responsibility to monitor and track the individuals from a public health perspectives falls within the mandate of the Public Health Agency, supported with information and data provided by CBSA. And this includes all decisions with respect to the pursuit of any enforcement action. It's important to point out, Mr. Chair, that because quarantine remains one of our most effective measures, that the enforcement measures are the responsibility of the police of jurisdiction. Health and enforcement officers are in regular contact with travelers to ensure that they are in compliance with quarantine orders. We work very closely with provincial, territorial, and municipal partners to enforce these measures. And the enhanced presence of border service officers, public health officers is helping. It's effective, and it's helping to ensure that travel will understand their quarantine requirements. The RCMP works very closely as well with the Public Health Agency of Canada. They play a coordination role for all Canadian law enforcement, and they're ensuring that the appropriate police of jurisdiction are provided with the information required to conduct physical verification of compliance with quarantine orders. Mr. Speaker, we'll continue to work very collaboratively in upholding these measures. Our quarantine measures, in my opinion, have been the most effective response to protect Canadians from the spread of COVID. We have rigorously enforced them, and they'll continue to be in place as long as they are required. Thank you, Mr. Chair.
Thank you, thank you, Minister Blair, and appreciate you being right on 5 minutes. With that, Minister Hajdu.
Well, thank you, Mr. Chair, and I'll say that I have with me today President Ian Stewart, who is the President of the Public Health Agency of Canada, and Deputy Harpreet Kochhar, who is the lead on this file. Listen, from very early days, a very important part of Canada's COVID-19 containment strategy has been mandatory quarantine requirements, and they're an essential part of our strategy, in fact. Last month, the Government of Canada established additional quarantine border measures for international travelers arriving in Canada by land or air. As of February 22nd, travelers arriving by air are required to stay in a government-authorized accommodation for up to 3 nights while they await the results of the COVID-19 molecular test that they take on arrival. And these accommodations are different from the designated quarantine facilities. Designated quarantine facilities are operated by the Public Health Agency of Canada and are generally used to accommodate symptomatic travelers or those without an appropriate location to quarantine themselves. Now, the requirement to stay in a government-authorized accommodation or at a designated quarantine facility is an important public health measure, and it is an important component to protect Canadians from the importation of COVID-19 and the variants. Our experts and scientists constantly carefully monitor COVID-19 outbreaks across Canada and indeed the world. We understand the risks, and we take the situation very seriously. Every public health measure that we have taken is an important approach that protect Canadians from the virus. Protecting the health and safety of Canadians has been our top priority as we continue to respond to the COVID-19 pandemic, and the Government of Canada has established strict quarantine and travel measures to reduce the importation and spread of COVID-19, and recently, the introduction of variants into our country. We know the virus is changing and shifting. It's very important for our country to be able to monitor how that virus is changing and what additional threat it poses to Canadians. Canada's mandatory quarantine program is an essential part of our COVID-19 strategy. Canadians have made important sacrifices to tackle COVID-19, including curtailing international travel. We are receiving more vaccines every day, and that is good news. We are at a critical inflection point in our fight against COVID-19, and we need to keep following public health measures and remain vigilant. The Public Health Agency of Canada has federal employees on site, has increased the number of security personnel at designated quarantine facilities to help provide a safe and secure environment, and we are in daily contact to support our partners in delivering the mandatory quarantine sites. And for that reason, Mr. Chair and honourable members, this is not the time to suspend federally mandated quarantine measures. I want to thank Canadians for the incredible sacrifices they have been making to protect each other from COVID-19, including curtailing essential travel. Thank you very much, Mr. Chair.
Thank you, Madam Minister, and I neglected to welcome you on behalf of the committee to public safety. With that, we turn to the second 6-minute round, starting with Madame Stubbs, then Madame Cara, Madame Michaud, and Mr. Harris in that order. Ms. Stubbs, 6 minutes, please.
Thanks, Mr. Chair. So to the Public Safety Minister, how is the misconduct of a designated screening officer handled? Is it up to their direct employer? And what recourse options are there for Canadians in cases of misconduct or criminal behavior?
Thank you very much for the question, Ms. Stubbs. I'm assuming you're referring to the private security member that was contracted in order to follow up on these matters, and where there's an allegation that has to be thoroughly investigated. The allegation is of a criminal nature, and the person, if the evidence warrants it, would face criminal charges and be held accountable in a criminal court.
Are people complying with federal quarantine measures given a list of their rights and the responsibilities and the limitations of screening officers so Canadians can identify potentially unsafe situations and protect themselves?
Yeah, to be very clear, people that are placed into quarantine are not being placed into detention. And so they're not being arrested, and they're not in custody. They're ordered into isolation through quarantine under the Quarantine Act. And therefore, this is not a designation where an individual, for example, is arrested. And as you probably are aware, that under the Constitution and under a significant amount of case law, a person who is being arrested, there is a constitutional requirement to provide them with information about their rights to retain and to obstruct counsel, etc. But these are not circumstances of custody and detention. Rather, it's quarantine under the Health Act.
So you have confirmed that every time Canadians know their rights when they're being directed to a quarantine facility?
No, Ms. Stubbs, perhaps I wasn't clear. These people are not being arrested. They're not stepping into custody. They're not being detained. They're being placed in quarantine.
Yeah, I'm simply asking if Canadians are told their rights when they're being told to go into quarantine facilities.
Well, no, ma'am. When they're directed into quarantine, they're referred to the public health agency who places them.
I'll try to find out from someone who knows. Does your government order risk assessments and ensure the safety and security standards for federally mandated quarantine facilities in order to protect occupants?
That question is quite properly more appropriately directed to the head of the Public Health Agency of Canada, who is responsible for those quarantine facilities.
I think every Canadian would hope, now that we are at least 2 weeks past reports of alleged sexual assaults within quarantine facilities and in the course of mandating federal quarantine compliance at home, that every Canadian would hope that you know those answers, Minister. That's actually indeed exactly why you're here. So then I'm assuming you don't know whether or not risk assessments are done. You don't know about the safety and security standards in those facilities. You must not know then who signed off on them. I hope you're getting a handle on the fact that operators have been telling single women not to tell people of their location and to leave their doors unlocked, and that there are, in some cases, no locks on the doors within those quarantine facilities at all, because this is, of course, a core responsibility of yours to provide the safety and security for Canadians when they're simply attempting to follow your rules. Are screening officers equipped with cameras or body cameras for accountability?
Yeah, thank you very much. I just got to go back on one of your points, because what you said is fundamentally incorrect. And I'm subject to the chair, I don't want to take up the member's time unnecessarily, but what she has said is incorrect, and I'd like an opportunity to correct it.
You have that opportunity.
Thank you very much, Mr. Chair. Just to be very clear, the operation of the quarantine facilities, the designated quarantine facilities, is entirely under the authority of the Public Health Agency of Canada. I actually have no jurisdiction over those matters. We do provide support and assistance through the RCMP to the Public Health Agency of Canada, but the questions that she asked, she incorrectly suggests that it is a responsibility of the Public Safety Canada. She's just simply misinformed. It's actually, her question's more appropriately directed to the Public Health Agency.
Thank you for the condescension. I do expect, though, that almost every single Canadian would hope that the Minister of Public Safety of this country would avail it of himself to ensure that Canadians are safe and secure within facilities or at home, trying to comply with rules that the federal government has set. Now, I'll assume you don't know the answer about whether or not screening officers are equipped with body cameras either. Does your government require enhanced security and background checks of the officers over and above employer screening?
And again, Ms. Stubbs, I have to advise you that they are not hired by the public safety, any agency of the public safety portfolio. Your question's more appropriately directed to the Public Health Agency of Canada.
Okay, here's one for border crossing. One of the alleged victims said she had her passport taken away before being sent to a mandated quarantine facility. Who would have taken her passport and under what authority?
Well, her first contact coming into the country would have been with CBSA. They would have made inquiries with respect to the suitability, for example, first of all, her right of entry and the suitability of her quarantine plan. I don't know the precise circumstances, but I have the benefit of having the president of the CBSA here. If you require that information and if he's able to disclose it, he's available to answer your question.
Ms. Stubbs only has 15 seconds.
Great. So since this crosses multiple jurisdictions, have you asked the RCMP to do a national investigation? Do you have any sense of officers after reports of the sexual assaults of Canadians?
Yeah,
that may be a very important question, but unfortunately,
I think it's probably the most important question.
Well, if it may be a very important question, nevertheless, you're out of time. With that, Madame Kara, you have 6 minutes, please.
Thank you, Mr. Chair. Allow me to also first thank both ministers for being here on such short notice, but most importantly for all the incredible work both you do, but certainly all your staff and all the officials that have been doing on behalf of all Canadians since the start of this pandemic a year ago. Minister, we're talking about the importance of strong quarantine measures that were announced last month specifically, because even prior to that, we actually had some of the strictest quarantine measures in place since the start of this pandemic back in March. So Minister Hadu, maybe I can start with you. If you can just perhaps talk about why these very strong and specific hotel quarantine measures were implemented in the first place.
Well, thank you very much, MP Kara, and through the chair. I'll just say that when the world was alerted to the increase in variants of concern, in particular the one that began in the UK, it was clear that we needed to track these variants, and we needed to understand not just these variants, but also how the virus was shifting and changing. Because, of course, when we see explosions of growth in other countries like the UK and the US and many other countries, some reported, by the way, and some that don't keep very good track of their numbers, it's important that we here in our country understand what variants might be imported that we know of, and in fact, any changes to the virus that could put the work that we've done collectively together at risk.
Thank you, Minister Hadu. Perhaps Minister Blair or Minister Hadu, you can just perhaps walk us all through the procedure, the step-by-step of, when someone decides to enter Canada, because I think there seems to, or might have been some confusion, at least among Canadians, my constituents, and I can see certainly with the opposition regarding which agencies have what responsibilities in terms of assessing and processing travelers at the border, which other jurisdictions are involved, because I was speaking with the Chief of Police in Peel, Chief Nish, this morning, and I know they have also been involved at the Pearson Airport. So for the sake of clarity, if I'm not sure that either the both of you or can answer and walk us through specifically how the CBSA and the Public Health Agency of Canada officers, along with other jurisdictions, are working together at the border entry points, and how their roles are actually, how they differ.
Well, for a point of clarification, maybe we start with the Minister of Public Safety and then go to the Minister of Health, because that seems to be the jurisdictional flow.
Yeah, thank you very much, Mr. Chair, and I'll try to be very brief in my response to give my colleague an answer opportunity to answer the second part of that process. Every person arriving at Canada's borders is subject to screening by the CBSA, who make a determination whether or not the person has a lawful right of entry into the country. And by the way, under the Constitution, all returning Canadians have a right of entry. It also includes permanent residents and Indigenous persons. So they ensure that people can lawfully enter the country. They also enforce, as I've mentioned, over 90 different pieces of legislation. But since the implementation of the quarantine measures, we've asked more of our border officers. They make a determination of the reason for travel. There is a very clear criteria that's been established by Order in Council for essential travel. And essential travelers are exempt, and there are a number of other exemptions that have been put in place by Order in Council. And so the CBSA officer determines whether the arriving traveler is required to enter into quarantine. And if they are, in fact, by the rules that have been put in place by Order in Council, that matter is then that individual is referred to the Public Health Agency of Canada. They also make a determination on whether or not the adequacy of the quarantine plan, and they order them into quarantine because they're designated quarantine officers under the Quarantine Act. They've been designated by PHAC. They are then turned over. We also check now since January 6th to ensure that they have a COVID test, a negative COVID test obtained within 3 days of their arrival in Canada in the country of origin from which they departed. That is a requirement before they even board the plane. And for people who are arriving at our land borders, they are also subject to either referral to PHAC for testing right at the site at now 20 different sites across Canada, or if they arrive at any one of the other I think it'll be 97 points of entry. They can be given a self-administered test by the CBSA officials. We then collect that information, pass it on through PHAC to the police of jurisdiction for follow-up and enforcement.
We have roughly a minute left.
Well, thank you, Mr. Chair. The handoff to the Public Health Agency of Canada, there's a number of different routes a passenger might take. If in fact they are symptomatic or they don't have an adequate quarantine plan, then they are transferred to a federal quarantine facility where they're supported to isolate, sometimes for the entire duration of their quarantine if their plan is not strong. What we're trying to protect against in these mandatory quarantine, designated quarantine facilities is the onward transmission of COVID-19, especially for people who are living in very crowded situations, don't have, for example, a private room to isolate within their household, or are in-house a household with very vulnerable people who might, getting COVID-19, actually die. We also, with the recent changes, people are asked to stay in a hotel facility if they're not required to quarantine in a designated quarantine facility for up to 3 days while they wait for their negative test. And they are supported to do so by the Hotel Association. The Public Health Agency of Canada has a number of supports for travelers.
Unfortunately, we're going to have to leave it there, Madame Kara. Now, I understand Madame Michaud is having difficulties connecting. Are we reconnected?
Merci, Monsieur le Président. Je suis là, mais je suis sur mon...
Thank you, Chair. I'm with you, but I'm on my cellular telephone, so I hope that I am heard sufficiently, nevertheless. Alors,
au ministre, très content.
Thank you. Thank you to the ministers, and I'm so pleased that the committee has decided to address this issue. From the very outset, it's been quite chaotic, hasn't it? Remember, before Christmas, people were concerned, people who were traveling outside of Canada, that they, who were doing this, even though it was recommended that they not travel. But they were worried. There were the variants in the UK. There were risks that they come into Canada. And we know that their quarantines weren't necessarily being monitored. There was, a couple of calls, to see if you were at home, easy enough to hide whether you're there or not. Anyway, the government decided eventually to impose this mandatory quarantine in hotels. I think this is a good measure, and it should be enforced and kept. However, there are a bunch of little problems with it, and it's taken several weeks as of the time when the government announced the application of this quarantine and the time that it actually came into effect. Meanwhile, a number of people were entering the country. So why? This is my question that I put to both of you. Perhaps both ministers can provide part of the answer. But why did it take so long to bring in this mandatory hotel quarantine?
I can start.
Sure.
Sorry, Mr. Chair.
All right, I don't mind the promotion.
That's well, thank you. And thanks to the member for, first of all, reminding Canadians that we've been asking Canadians to forego non-essential travel now for a year. And I want to thank Canadians who have complied. It's been a difficult time for Canadians, many who have family overseas and all kinds of different reasons for wanting to travel, but now is not the time for international travel. The quarantine measures that have been in place for over a year are some of the strongest in the world. In fact, we've had mandatory quarantine in place for a very long time and high compliance rates. But we added an additional layer of protection, as I said, after the variants of concern became better known in terms of first of all, the one identified in the UK and others identified in other countries that have had vast growth in COVID cases, and that has led to the virus mutating. We have always used science and evidence to decide how we should proceed next in our fight with COVID-19. And certainly we heard concerns from the scientist community about not just the variants of concern that the world had identified, but certainly how the virus might shift and transform into the future. And given that we're at such a critical stage of our fight with COVID-19, we are seeing some success with provinces reducing cases. We are seeing success with our vaccination rollout, that it became very clear that we could not take any chances when it came to not being able to identify and screen for variants of concern. And I will tell you this, 100% of cases that are identified as positive at the border are screened for variants of concern, and we have identified a number of them. This is an important additional layer of protection while we enter into this next phase of vaccination and protection for Canadians.
Monsieur le ministre, vous voulez ajouter quelque chose?
Perhaps the minister wishes to add something. If not, I will add that I don't think it works to tell Canadians not to travel. We see that Canadians have traveled nevertheless and have brought back variants of concern. Why not simply ban all non-essential travel? So many people have good reasons to go overseas, take care of a loved one, and so on and so forth. Then, of course, there's the quarantine. Those who have enough money to pay for quarantine in hotels are willing to take the risk or just don't even follow the rules. So why not just institute a total ban?
Ms. Mitchell, for the question, and I will endeavor to answer that quickly. First of all, I would remind us, when the variants first emerged in the United Kingdom, we were among the first countries in the world to take very immediate and strong action to ban all flights from the United Kingdom. And over the ensuing days, we found that the variants had unfortunately spread into other countries. And so we imposed an additional layer of security, and we required that all Canadians coming in, all people flying into Canada from any place, whether essential or non-essential, must first obtain a negative COVID test before they came to the country. We've also implemented requirements that they would also then submit to an additional test upon their arrival. And as the variants and the concern that Canadians had about the emergence of these variants began to grow, we've added additional layers of protection in order to protect Canadians and to stop the spread of these variants. The measures that have been put in place were determined based on the advice that we have received from our public health officials that this was the best way to provide assurance of Canadians' health and safety for arriving non-essential travelers, and that's why we've implemented those measures.
Yeah, roughly 30 seconds.
Bon, j'aimerais savoir peut-être pour.
I would like to know why it took so long at the outset to be able to get online to reserve a hotel room. People would wait 24 hours. Why not have an online reservation system that would allow people to reserve directly with the hotels and then present their evidence of a reservation once they got to the airport?
It's not in the case of air travel.
Minister Blair, I think you were jumping in.
Yeah, I was. And Jack, I'll try to answer this briefly, and I don't mean to interrupt Minister Hajdu. I would just point out, Jack, that there are 117 land points of entry that where Canadians can currently cross when they're returning from the United States. In addition to returning non-essential travelers, over 90% of the people that cross at those land border points of entry are truck drivers. They're essential workers. They're bringing to and from Canada essential supplies, and it's a very small cohort. And it's in most border locations, less than 5% of the travelers who are coming to that border are non-essential in nature. I'd also point out that although some of them are located in fairly dense urban populated areas, the vast majority of them are quite remote. It's hundreds of kilometers, in some cases, several hundreds of kilometers from any possibility of a hotel or even PHAC staff at these things. And so we've implemented the measures that we believe are appropriate and necessary and are effective given the size of the cohort of the people we're dealing with. People who arrive at the airport, more than 90% of the people arriving at the airport are non-essential travelers. And yet only like a significantly smaller proportion of people at land borders are non-essential. And so the measures we've put in place, we believe are the right measures. And I would also point out that at the airports, we've limited all international travel to 4 international airports. They're located in Montreal, Toronto, Calgary, and Vancouver. Clearly large urban centers where hotels and PHAC staff are available to manage the measures that have been put in place there.
So you're basically, though, Minister, you're saying that that the alternative measures that are available at the border are not available in at the major airports for incoming traffic, and I find it a contradiction, I'm afraid. But
quite the opposite. The measures that are available at the major airports are not available in Snowflake, Manitoba. They're not available in Beaver Creek in the Yukon, and so we've had to implement measures that are appropriate to that environment and those circumstances.
Another follow-up question on, and I think there are, and I wasn't here for your presentation, Minister Blair, because I was told by our whip's office that the committee had been rescheduled as a result of the votes to 5 o'clock, but that's unfortunate. So if I'm repeating something that has already been answered, we've been told that the obligation to, or the designation of people to a particular hotel and all of those rules are actually determined by the under the Quarantine Act by the reading from the note here. It says that they must remain with travelers quarantining a hotel. The facility is required to safely transport travelers from the airport to the hotel and provide travelers with lodging set by the Public Health Agency, but also provide the travelers with necessities and a safe and accessible environment. And I'm wondering, does that mean that you've downloaded the responsibility for safe transport from the airport to the hotel to the hotel owners and the safety within the hotels to the hotel owners as well? Is that the case, or is it still the responsibility of CBSA to make sure that they, as quarantine officers, they get safely to the hotels, and that while they're in quarantine under government obligation, that they are protected by the officials of the Canadian government, the quarantine officers, or whoever else is appointed for their safety?
Unfortunately, that question is going to have to go unanswered because Mr. Harris has gone through his 6 minutes. Colleagues, we have 25 minutes worth of questions.
Sir, so maybe someone could answer at some point.
Yes, well, I'm sure someone will work it back. We have, colleagues, 20 minutes left in the time allotted, but we have 25 minutes worth of questions. Unless I see real objection, I propose to do a full second round and go past the time. So with that, I could call on Madame Rempel-Garner. Welcome to the committee. 5 minutes, please.
Thank you, Chair. Minister Hajdu, is the government in possession of data that shows that the quarantine hotel program is more effective to preventing the spread of COVID-19 variants than at-home quarantine coupled with pre- and post-arrival testing?
Thank you very much for the question, Mr. Chair, through you. The quarantine and mandatory quarantine has been an important part of protecting Canadians from the importation of COVID-19.
Chair, that's not what I asked it. I only have 5 minutes. Is the government in possession of data that shows that the quarantine hotel program is more effective at preventing the spread of COVID-19 variants than at-home quarantine coupled with pre and post-arrival testing? Yes or no?
Thank you, Mr. Chair, and through you, I'll say that the government has proceeded in this way to make sure that people have a safe place to stay while they receive the results of their test at the airport. This test is very important, as I've mentioned before. It will, first of all, show if someone is positive for COVID-19, but secondly, allows...
Well, Madam Member Garner, generally speaking, I allow the same amount of time to answer the question as to ask the question. You had about 20 seconds to answer the question. Ms. Hajdu, Minister Hajdu was right on the 20-second mark, and I anticipate that she'll be able to complete her answer without further interruption. With that, I'm going to have to restart this clock somehow or another. You have about 10 seconds to answer the question, and I don't know where I am with Ms. Marble Gardner's time. Anyways, go ahead. 10 seconds.
5 more minutes.
Thank you. The new approach allows the government to test all samples for variants of concern. As I mentioned, this is a very critical time in our fight against COVID, and those variants of concern, both known and unknown, are important to understand.
Okay, well, then now Ms. Marble Gardner.
Through you, Chair, various charter challenges have asked for data from the federal government showing that the hotel quarantine program is more effective at preventing the spread of COVID-19 variants than at-home quarantine coupled with pre- and post-arrival testing. Does the minister have that data?
Mr. Chair, we have had participation with a number of provinces and territories and other partners to understand various approaches at the border in terms of quarantine and the combination of quarantine and testing. We're continuing that research with partners to understand how best...
Am I safe to take that as a no?
You're not. I'm not answering the questions. I'm like the speaker that way. I don't answer questions.
Through you, Chair, am I safe to take that as a no? The data doesn't exist.
I can't answer that question, and I don't think I should be answering that question.
Through you, Chair, to the minister, am I safe to take it that that data doesn't exist?
No, I don't think that's what I'm saying. What I'm saying is that...
So it does exist.
What I'm saying is that research is underway internationally about how best to manage international travel.
Does that data exist in Canada?
As I said, Mr. Chair, it is very important that we understand the addition of variants of concern.
So it doesn't exist in Canada?
Mr. Chair, as I said, this question of what the most effective combination is between quarantine and testing...
So it does exist in Canada?
...is very important to the Government of Canada and indeed international governments around the world as we try...
So it doesn't exist in Canada?
Point of order, Mr. Chair.
Yes.
I'm finding to be this becoming a bit of a bullying, and I think if the minister's asked a question, she should be given time to answer it.
Well, point of order, Chair.
So
on that point of order,
I would appreciate that while she's answering, she can finish her sentence.
Well, point of order, Chair. On this particular point of order, I would argue that the women who experienced sexual assault at the quarantine hotel due to this lack of data would in fact be the women who would have experienced bullying in this situation. So my question is material, and I would like a yes or no answer. So out of respect to that victim, a yes or no answer is needed. Thank you.
The data.
Go ahead. The minister will answer the question in the fashion she chooses to answer the question. Whether or not the member is satisfied with the answer is an entirely different matter. She will have the same amount of time to answer the question as was to ask the question. So with that, Minister, you have about 10 seconds.
Thanks. I will just say this. The data is incomplete internationally. We are, as a world, trying to figure out what the best approach is to prevent the importation of COVID-19, the combination of quarantine and testing, and we are it is under study.
Thank you. So is that an admission that this was a political decision to discourage March break travel as opposed to a data-driven decision that shows that the quarantine hotel program would do better at spreading the variants than at-home quarantine?
No, I think it's inappropriate for the member to put words in my mouth. What I said is exactly what I just said, which is that we take our obligation very seriously to ensure that we are doing everything in our power to prevent the importation of COVID-19 and in particular,
So where's the data?
variants of concern.
So where's the data?
As I answered previously, the data is incomplete in terms of what combination of measures are needed.
I'll finish with this. Was a gender-based analysis completed for the hotel quarantine program?
Mr. Speaker, everything we do at the Government of Canada is done with the utmost care for Canadians.
Was a gender-based analysis done for the hotel quarantine program?
Mr. Speaker, the Government of Canada takes its obligations very seriously to protect all Canadians.
A gender-based analysis was not completed for the hotel quarantine program.
Mr. Speaker, the member again is trying to assume what I am saying confirms her assumption, not correct.
Well, was a gender-based analysis completed for this program?
Mr. Speaker, every step of the way, this government has had the protection of Canadians.
Would you say that it's misogynistic to not complete a gender-based analysis for this program that saw sexual assault occur?
Mr. Speaker, the member opposite should know that this government puts the safety of women and girls
like
at
no
the
locks
center
on the
of everything
doors
that we do.
and a rape. So was there a gender-based analysis completed for this program?
Very briefly, Minister, because Ms. Rempel-Gardner's time
Mr.
is
Speaker,
up.
if the member opposite is implying that anyone is not horrified by the sexual assault of women, then that is simply incorrect.
With that, we are moving on. Thank you, Ms. Rempel-Gardner. Ms. Lambropoulos.
Thank you, Mr. Chair, and I'd like to thank both ministers, Minister Hajdu and Minister Blair, for being with us today, and also for all of the work that you and your teams have been doing since the start of this pandemic. Minister Blair, one of the things that you mentioned that caught my attention was a fact that you basically said international travel by air has been down by 59% since these measures have been put into place, and that there's an over 99% compliance rate. Can you give us some more insight as to why you think that these new measures have been effective and why you think this was the best way forward?
You're on mute.
You're on mute.
Sorry, I also took myself right out of the chat for a moment, but I'm back. I apologize. With respect to the measures that we put in place, over a year ago, we began to urge travelers, we issued travel advisories, we urged travelers to avoid non-essential travel because we recognize that the risk that represented to Canadians as those travelers returned. We then, over a year ago, began putting very rigorous measures in place. Canadians overwhelmingly listened, but we know that there are some people, for a number of different reasons, may choose to travel. And we also know that under the Constitution, Canadians and permanent residents and Indigenous people have a right of re-entry back into Canada. And so the measures that we put in place were put in place to respect that right. But at the same time, we've made it very clear that the quarantine measures that we have required people, non-essential travelers, to enter into, I will tell you the evidence is overwhelming that those have been the most successful measures. The quarantine coupled with tracing and testing that has been put in place have been the most effective measures in order to protect Canadians from the spread of COVID. And we continue to add layers of protection. Canadians have listened. I shared with this committee the fact that when we put a requirement in for people to have a pre-boarding test, and now at land borders, before they arrive at the border, a negative test obtained within 3 days. We heard from many people who said that was too onerous and difficult to do, and I think we've all seen, some of the media reports of people who have quite proudly defied those requirements. But the reality is, the overwhelming majority of Canadians have respected those requirements, have complied with it, more than 99%. And for those who choose not to, there are appropriate ways to resolve that, and fines are possible. But our goal always has been compliance, not enforcement. And I'm very proud to say that the overwhelming majority of Canadians have respected those rules and the reason for those rules and are in fact complying.
Thank you. And I have to agree with you. I mean, the many constituents that I've spoken to about this issue agree that this was the way forward, and we're happy to see stricter measures taken. Many of them had actually suggested to me months ago that we begin quarantining people in hotels in order to make sure that the rates stayed down. So was very, very happy to see that and was advocating for it. I also saw a few people cancel trips because of this. So I know that it was effective in making sure people, did not travel during this time if they didn't absolutely need to. I'd like to also ask another question. I know that in a very short period of time, many CBSA officers were hired. I don't know which of you can answer this question, but can anybody on this call answer the question as to whether the right steps were taken in order to make sure that background checks and everything was done to make sure that the right people were hired, and this wasn't just rushed because we needed more and more support at the borders?
Yeah, I can certainly answer that. I'm responsible for CBSA, and I have joining me today the president of CBSA. The CBSA officers that have been sort of answering the call throughout this entire pandemic, in my opinion, have done an extraordinary job. We did, close down a number of remote and smaller points of entry so that we could concentrate our resources. The change we made on international travel to concentrate it into 4 international airports in Montreal, Toronto, Calgary, and Vancouver, for example, was an acknowledgement of the extraordinary amount of work. I will also tell you that these measures have had an impact on their workload. It has affected the time it takes to process travelers and goods arriving at our border because of the additional measures that we have put in place. We've had a number of orders in council which have placed additional requirements on our border service officers. They are all trained and designated, for example, as screening officers under the Quarantine Act. They perform a very important role of protecting Canadians from people coming back into the country to ensure that they're not ill, and secondly, that they have an appropriate plan, and they perform an important role of referring individuals who are going into quarantine to the Public Health Agency.
Thank you.
Very much.
Point of order, Mr.
Thank
Chair.
you, Mr.
Point of order.
Point of order. Yes.
Thank you, Mr. Chair. I would just note that Madam Kara asked us a very similar question to a question that Ms. Stubbs asked in her opening round, yet the minister repeatedly said that was PHAC's jurisdiction and refused to answer that question, yet when a very similar question, although asked in a little bit of a different manner, was asked by a member of the government's party, the minister certainly had lots to say. I think it's concerning that and sets a troubling precedent about ministers and how they are meant to be held accountable at these committees.
I agree with you that is a point of observation. I'm not sure that it is a point of order. With that, thank you, Madame Lambropoulos. And I will, by the end of the year, be able to pronounce your name correctly. Madame Michaud, de moins 5 minutes, s'il vous plaît.
You have 5 minutes, Madam. Thank you, Chair. I would like to know, when the decision was made about hotels offering quarantine, were they given clear directions on how to go about this? The prices to charge clients, the basic services to offer, the essential services? Because we have heard about the, $2,000 mentioned by the Prime Minister. It mightn't have been $2,000. I've heard a story of a single mother arriving with her children, and $300 was what she thought she'd be charged. Finally, it cost $700 a night. Were the hotels allowed to charge whatever they liked? Were they left to decide how to set up security measures, and what kind of directions did you give them?
Thank you, Mr. Chair, and thank the member. Excuse me. I thank the member for the question. We worked really closely with the Canadian Hotels Association, and in fact posted requirements that hotels needed to meet in order to be considered as a facility that we would contract with. I'll turn to Ian Stewart to speak to some of the specifics on the requirements that hotels needed to meet in order to be considered for the program.
Roughly a minute, please.
Okay, thank you for the question. We put a slate of criteria on our website that hotels had to meet if they were to be deemed eligible to receive travelers, and they had obligations and have obligations that they have to meet, including, as was mentioned earlier, safe transport of travelers from the airport to the hotel, security on site to ensure safety of people, and also providing the necessities of life, a safe and food and also housing adequate to their needs. There is also a number if they have any issues or concerns, and we also do spot checks and we also do site inspections regularly to make sure that they're complying with the requirements. Thank you.
You have about 30 seconds.
Est-ce que le fait d'enlever les
Was taking off locks on door rooms a directive of public health, or was that a decision just made by hotels? For example, the woman who was sexually assaulted, she didn't have access to a lock, it seems.
UF facilities, the designated quarantine facilities that PHAC runs, and then of course the private sector hotels that we're referring to here had no direction from us at any time to remove locks or any security devices of any nature.
Okay, thank you, Madame Michaud. Mr. Harris, 2.5 minutes, please.
Thank you. To avoid the risk of not getting this question answered, rotational workers in the offshore industry in Newfoundland work internationally, and many of them are working directly in a quarantine situation in an offshore location with a quarantine before they go off the offshore rig, quarantine on the rig, quarantine when they come back, and they come back to Canada. Why are they not able to be exempted from some of these obligations so they can come back to Newfoundland and Labrador and be with their families instead of having to go through a hotel? We have workers coming from Houston, Texas, or other parts of Texas to work in our offshore, and they are provided with an exemption. Why cannot the rotational workers who are also coming to work, working in the same industry, essential work that's being done, and are subject already to very serious quarantine locations all the way through their work rotation?
Thank you.
This is for Minister Hadju. The exemptions and exceptions are determined by them. You guys just apply the rules. I understand. If I'm wrong, correct me.
Well, it's been a collaborative approach, actually, and the essential workers list has been developed across government. It's hard to speak in generic terms. Many workers in a variety of different fields are considered essential and therefore are exempt from quarantining in hotel upon arrival at airports. So it's hard to speak to the specifics of those particular workers without understanding their nature. Maybe I can turn to Minister Blair if he wants to add anything.
Yeah, actually, public safety did develop the list and defining essential work, and that is a determination made by the Border Services officers at the Custom Hall, whether or not the person qualifies for exemption. Jack, I'm going to agree with you that we've put a number of very significant exemption measures in place, but also protection measures for temporary foreign workers. If you want to follow up with me on the specific aspect of those workers, I'll pursue it on your behalf.
Roughly 20 seconds.
Thank you, Chair. Well, I can give 20 seconds to someone to maybe Mr. Stewart can reflect this. If it's downloaded the responsibility for security to hotels, how you say you didn't mandate they take the locks off, but who made sure that they had locks on?
Mr. Speaker,
that 20 seconds has just become 2 seconds, and I'm going to move on because
Mr. Chair, I think an answer would be in order here.
I'm sure.
Agreed. Absolutely.
There was a lot of answers from Mrs. Rempel that went over time.
No, Mrs. Rempel did not go over time, and if I'm going to run a clock and try to stay within some semblance of the time allocated, I have to be somewhat arbitrary. So I've now had to be arbitrary twice, Mr. Harris. With that, Mr. Motz is up. 5 minutes, please.
Thank you, Chair. Minister Hadju, you claim that there is a need for hotel quarantines rather than to quarantine at home. You then claim that the data to support that decision is incomplete. Can you table the evidence you do have, although incomplete, to support the determination that hotel quarantining was required rather than at home?
No, what I'm saying is that the data is incomplete to determine the best approach at the border to manage COVID-19. We do know that mandatory quarantine has been an essential component of controlling COVID-19 domestically, and we do know that mandatory quarantine has reduced significantly the importation of COVID-19. But with the variants of concern, of course, we want to be able to screen those positive cases to understand how the virus is changing and shifting.
So,
and it is early days.
I'm still confused. Then you said you have the data is incomplete, and yet you don't want to present it, and yet I'm led to believe, and I understand that there was a federal judicial review done just recently on a suit that was came out of Alberta, and the Department of Justice lawyers on the government's behalf sent some information back that said that they're not able to release the data used to make these determinations because it's cabinet confidences, which means that you do have some data. You're just not telling us. And don't you think that, as a government who trumpets themselves as being transparent would want Canadians to know? Don't you think Canadians want to know the data used to make these important decisions?
Yeah. Mr. Speaker, again, Canadians expect us to take strong measures at the border to prevent the importation of COVID-19. Of course, it's important that any Canadian that arrives at the borders who is positive or who does not have a quarantine plan that protects the other people in their household has an appropriate place to stay. That's why we have the designated quarantine facilities and the quarantine hotels that we've contracted with the Canadian Hotel Association are there to help support Canadians to isolate while they await their mandatory test upon arrival at the border. And it is very important that we have the positive test to run sequencing on so that we can understand how the virus is shifting and changing. We watch for variants of concern that we know any changes
Chair,
that we don't know.
The minister doesn't have the data or doesn't want to share the data or isn't telling us the data that they do have. In the time that I have left, I just want to share my own thoughts and as well as Canadians and to both of you as ministers. Canadians believe, and I believe, that you have failed in your duty to protect Canadians and instead put them at greater risk. You have refused to disclose information explaining the public health benefits, leaving us to conclude that there is no data and no information to support your position on this. You misled Canadians and travelers, making them believe they would be in a hotel, but instead they were in an unlocked room with limited water, no food, and under watch of cameras with no security personnel to help them. This was a massive, expensive, and dangerous failure. And we have victims, only 2 that we know of, and if there's 2, we know that there's a lot more, who will now carry this for the rest of their life. Will you remove the risk to future Canadians and end this mandatory hotel quarantine?
Roughly a minute.
Mr. Speaker, if I may, let me begin. I thank the member for his observations, but let me be very clear. The measures that we have put in place have been entirely intended to protect Canadians, and they have been effective in protecting Canadians from the introduction of the virus and its variants into this country. The allegations of sexual assault are taken very seriously. I would just remind the member that these issues are being thoroughly investigated by the police of jurisdiction. I think it's probably appropriate to wait the outcome of that investigation so that we can actually talk about the facts. But both of these terrible events are alleged to have occurred in jurisdictions not under federal authority, and so they are being investigated. I'd also remind the member that these measures, hotel quarantine, just as an example, has been introduced in the United Kingdom, in Australia, in New Zealand, and many other countries around the world. And again, those countries, like Canada, are doing their very best to protect Canadians. And frankly, this is not a matter of politics. It's a matter of safety and of health of Canadians. That's our priority, and that's
we're going to have to leave it there, Mr. Motz. The final question goes to Mr. Iacconno. 5 minutes, please.
Merci, Monsieur le Président.
Thank you, Chair. And thank you, kind ministers, for having joined us here today. Madam Minister, one of my People in my riding, Alfred Bellon, asked me if a child over 17 years of age were returning with their parents from a trip outside Canada could be held to be a child in the care of the parents and thus could be exempt from confinement.
Thank you. And to my colleague, thank you very much. If the child is traveling with his parents, then yes, he would be subject to mandatory quarantine as well. I'll turn to Ian Stewart to speak a little bit more about minors that are traveling.
Minister, you're completely correct. The minors would be kept with their family, with their parents, and travel with them in that regard.
Merci, Madame la Ministre.
Thank you, Madam Minister. Generally speaking, in response to people who are calling for exemption to the hotel stay, it's getting very complicated for them to manage this. Could you remind us of the exceptions, the only exceptions now possible at present?
Reminder to tell all Canadians now is not the time to travel. And we've been saying that to Canadians for a long time, to forego non-essential travel. What is essential travel? Travel that is only required for work. There are very few exemptions to our request, and anybody who pursues non-essential travel will be subject to the mandatory quarantine rules when they arrive back in Canada.
Merci, Madame la Ministre.
Thank you, Madam Minister. So, Minister Blair, we're here today to discuss quarantine in hotels for people who are coming in back to Canada from outside the country. No similar requirement exists for those who come in by land, however, compared to air entry. Is this logical? And what's the logic? Second, what measures have been taken to ensure that those who are coming in at a land entry point will not be bringing in COVID or transmitting it to others?
Thank you very much for the questions. And let me assure you, it's entirely logical if we consider the environment at land borders. We have all international travel concentrated into 4 large urban international airports, where there is lots of facility, resources, and staff to manage the measures that the Public Health Agency of Canada has put in place. But we recognize we have 117 land border points of entry, and the vast majority of people crossing those borders are essential workers or people moving essential goods. And so under the circumstances of our land borders, in some jurisdictions, such as Laval, just south of Montreal, the Public Health Agency of Canada is present, and for everyone entering at Laval, for example, and there are 20 other locations in Canada similar to Laval, everyone is required to produce a negative test taken within 3 days of their arrival. They're also subject to an enhanced screening. They're ordered into a 14-day quarantine, and they are tested at point of entry to determine whether or not they are negative even as they come into the country. Those are very rigorous and important and effective measures, and we've seen a very high degree of compliance. And in fact, at land border measures, compliance with measures we put in place is at 99.5%. So it's very, very effective. But it would be impractical and perhaps even impossible to require people to transit to a hotel, and at some of the vast majority of our points of entry, where the nearest hotel might be hundreds and hundreds of kilometers away. And so we have other measures that we've implemented in those places in recognition of the unique environment. And I would just simply remind this committee, those measures are working, and we are doing the work necessary to keep Canadians safe.
Merci, Monsieur le Ministre.
Thank you, Minister. Another question. The isolation in the hotels, they're often being attacked, saying that they're excessive, they're like an imprisonment, and that they don't respect the Canadian Charter of Rights and Freedoms. Could you tell us more what you think of that?
30 seconds, please.
Maybe I can take this one, Mr. Chair. The isolation in hotels, obviously these are in hotels that are professional hoteliers who are providing the utmost of service as they do to regular, normal travelers who travel, for other purposes. I will just say the isolation is through the Quarantine Act, and the Quarantine Act exists to protect Canadians from the spread of disease domestically.
Okay, we'll have to leave it there. Thank you, Mr. Yakino. On behalf of the committee, I'd like to thank the ministers and their colleagues for attending. We are now about to suspend while we re-impanel for the next 2 hours of witnesses. So again, thank you.
Thank you very much, Mr. Chair.
Thank you, Mr. Chair.
For some of you, this will be the first time before a parliamentary committee, and others I see are real veterans before the committee. Colleagues, this time is scheduled to be 2 hours, but we went about 15 minutes over last time. So I need some indication as to whether you wish to go 2 hours or whether you wish to go an hour and 45 minutes.
Chair, an hour and 45 minutes I think should be fine if it's okay with everyone else.
Okay,
Chair?
so we'll run the, where am I? Who's up next?
Chair?
Yes.
The motion was for 3 hours. We had the ministers for an hour, and we started at 5:49. We ended at about 5:49. So I would say that let's do a full 2 hours with the officials, please, in honor of the motion.
Well, we actually started earlier than that, but I am in the hands of the committee. We can go 2 hours. I'm fine with that. I just want to make sure the witnesses are as well. So,
how long did we go, Chair? Sorry, how long were the ministers here? Because you did extend it.
Yes, I did extend it. We were supposed to end at 5:45, and we ended at almost 6. Well, not quite 6. So I was clocking it as an hour from at 5:45.
So whatever the full 3 hours is, if it means shortening this by 5, 10, or 15 minutes, whatever it might be, maybe the clerk could just double check the timing. Sure. I think 3 hours. Okay.
All right. Well, we'll never get through this. We don't get it started. So we'll once we're past two rounds of questions, I'll have a time for the members. With that, and in no particular order, we've asked witnesses to speak for 5 minutes, and then we go to questions. We have Dr. Isaac Bogosh with us, the Canada Border Services Agency, Public Health Agency of Canada, Royal Canadian Mounted Police. If I could ask Dr. Bogosh if he has remarks for 5 minutes, you're more than welcome to make them. And if not, well, we'll move on to the next witness.
I'd love to. Thank you so much. Good evening, everybody. My name is Isaac Bogosh. I'm an infectious diseases physician, and I'm a scientist based out of the Toronto General Hospital and the University of Toronto. And thank you very much for inviting me to the Standing Committee on Public Safety and National Security. Obviously, the main issue here is to discuss the quarantine hotels, but clearly this is a symptom of a much larger issue, and that's how to protect Canadians from the external introduction of COVID-19 with sound border and travel measures. Now, this is a rapidly changing environment. We need border policy that will adapt to growing immunity from that we get from vaccine scale up in Canada and the US and elsewhere. But the key here is that the policy today will hopefully look very different than the policy we have in the months ahead as we gain population level immunity and as we have a better understanding of what the true protective effect is of these vaccines for example, the emerging variants of concern that we've heard so much about. But the immediate issue is obviously to discuss these quarantine hotels. It's clear that they're not without harm. We've heard about the disturbing reports of sexual assault. We've heard about logistical issues, costs, and loopholes. But it's important to remember the key goal here is to prevent the importation of COVID-19 and variants of concern that are more transmissible or have the potential to escape immunity. Essentially, it's to buy us time in Canada to vaccinate ourselves. It's interesting, the Public Health Agency of Canada actually instructed all Canadians to avoid all unnecessary international travel since March of 2020. It's been a year. These most recent prohibitive measures really accomplished two related tasks. They basically dissuaded travel by adding costs and inconvenience, but they also created mechanisms to decrease the likelihood that imported cases of COVID-19 and the variants of concern would spread within Canada. How helpful is this? How helpful are the quarantine hotels? Emerging data will answer this and address if we truly are getting incremental benefit from them, and if so, how much. And of course, this isn't a long-term strategy. So what are the better alternatives? There's ample ways to prevent infection from getting into Canada or a country in general, and to ensure people adhere to quarantine measures. In isolation, none of these are perfect, but bundled together, they provide incremental safety. The big categories are, number one, travel bans. You either prevent people from leaving your country or coming into your country, not an ideal long-term solution. Number two is testing. And we've seen here pre-travel testing and testing on arrival. Those are very effective and helpful. Number three is home quarantine. And you can add to that periodic check-ins by phone or person. And of course, you can add technology to really ensure people are staying at home and to track movement. I'm not saying we should do this. I'm saying this is on the buffet table of options that are available to us. And then number four is hotel quarantine. And we already know what the problems are with this. It's expensive. It's a tough environment to control. It's logistically challenging, but it's still an option. There's a few other semi-related items that we should be considering. The measures have to be commensurate with the current and future threats. The problem is we don't fully appreciate the full impacts that the variants of concern have. So to what extent do they evade immunity? How protective are our current vaccines approved in Canada against them? And we have emerging data suggesting that some of the vaccines, like the Pfizer vaccine, may provide decent protection against all the major variants of concern. But there still are many unanswered questions, and we will have more clarity in the weeks and months ahead. We also should consider fully vaccinated people pose far less of a threat. The vaccines aren't perfect, but they're really, really good. And it's worthwhile starting the conversations about considering fully vaccinated people to travel without quarantine, perhaps if they have negative testing. There's already behavioral guidance now for vaccinated people in the United States. So for example, the CDC says those who are fully vaccinated don't need to quarantine if they're exposed to someone with COVID-19 and are asymptomatic. Other countries like Cyprus recently announced they're allowing fully vaccinated tourists in the near future. So proof of vaccination at the border, obviously there's ethical challenges, but this is likely going to happen in many countries around the world. And there are obvious, even with these obvious ethical and equity issues, they can be imperfectly ameliorated by providing vaccination free of charge at the border. We can also do things like shorten quarantine periods to 7 to 10 days and test at the tail end of this. And lastly, I think it's important to recognize that close to 75% of travel across the land border is currently exempt from quarantine regulation. So it's a good idea to prioritize those essential travelers for vaccination. So in sum, it's important to adhere to the precautionary principle in the context of an unknown and potentially devastating threat of the variants of concern. Either they're more transmissible or they escape immunity, or sometimes they might even be more deadly. But we'll have a rapidly growing understanding of what these variants pose in the coming weeks and how our vaccine program will fare. So let's look at the available data that's growing. Let's look at the available data from the quarantine hotels, and then we can make value judgments and see whether it's worth continuing this plan in the short term while we simultaneously look for an exit strategy that can heavily rely on testing and perhaps home quarantine with additional tools and support for better follow-up. We also have to plan for all of this to change with time as the Canadian and global population level immunity grows. Thank you for your time.
Thank you, Dr. Bogosh. Canada Border Services, either Mr. Christensen or Mr. Vignette.
Yes, good afternoon. We did not have the opportunity to sound check with myself. I had some problems earlier, so just want to make sure that everybody can hear me.
Mr. Clerk, is that good?
He's okay.
Okay. Go ahead, Mr. Bennett.
Thank you. It's a pleasure for us to be here. We had been advised that based on the minister's statement at the opening that we wouldn't need to give an opening monologue, if you will, in terms of our participation today. But we are very pleased to be here, myself and Mr. Christensen, to address any and all questions that come our way as it pertains to the border. I might add that it's been near a year, and a year ago we established our CBSA Border COVID Task Force, led by Mr. Christensen, to begin to implement a series of measures that bring us to this day. And it's been a series of sequences and steps that have brought a series of new, if you will, controls at the border, each informed by direction from our colleagues at Health Canada and the Public Health Agency of Canada. And therefore, we've worked diligently to ensure that our officers had the right direction, the right information, and the right support to be able to make those day-to-day decisions that are required of them. And so on that basis, I'd leave it at that, but we'll be very pleased to support the committee in their work today. Thank you.
Thank you for that. Public Health Agency of Canada, Dr. Kolchar, Madame Digio, or Madame Evans, one of those, I assume.
Thank you, Mr. Chair. I'll start. So again, thank you to the honorable members also. I'd like to start by echoing the earlier sentiments which were expressed that the travelers who are in quarantine should feel safe and secure at all times. Aujourd'hui, je suis ici pour vous parler de mesures à la frontière.
So I'm here to discuss measures at the border that have been set up to protect Canadians from COVID-19 and its variants. Though the Government of Canada is recommending that Canadians avoid all travel outside of Canada at present, anyone who is so traveling must be fully aware of the restrictions now in place.
Entering Canada must quarantine for 14 days starting the day they arrive. And travelers coming to Canada must submit their travel and contact information and a suitable quarantine plan via ArriveCan app before they board their flight or before they cross the Canadian border. Before boarding a flight to Canada, a traveler must also provide a proof of a negative COVID-19 molecular test taken up to 72 hours prior to their flight departing. And alternatively, the traveler can provide a proof of positive test taken 14 to 90 days prior to arrival in Canada. And for travelers who are arriving by land, who are providing a proof of a negative test result, molecular test has to be taken in the United States. So travelers arriving in Canada by land or air, with limited exceptions, must also take COVID-19 molecular test on arrival. And in addition, they will be required to take another test forward towards the end of their 14-day quarantine period. Also, again, with limited exceptions, travelers who arrive by air must pre-book and stay up to 3 nights in Government of Canada authorized accommodation while they wait for the results on their arrival test. Le coût de l'hébergement à l'hôtel est à...
Now, at present, the cost of travel includes the housing, food, transportation, necessities, and control of infection.
Due to their place of quarantine, finish their quarantine period. And if the traveler's result is positive, they will be transferred to designated quarantine facility or another suitable location to complete their 14 days. Government of Canada employees and also security personnel are stationed at the designated quarantine facilities so that to ensure that all the entry and exit points are secure, controlled, and monitored. Travelers also required to stay in one of these facilities are provided with information that outlines the detail of quarantine requirement, which includes a code of conduct and potential fines for non-compliant behavior. L'Agence de santé publique a récemment...
The Public Health Agency has recently enhanced its presence to ensure security in quarantine facilities and will continue to provide adjustments and update the situation to guarantee the safety of anyone using these facilities.
At the facilities and had developed enhanced policies and procedures. Public Health Agency of Canada works with RCMP and provincial and municipal law enforcement to verify compliance and quarantine isolation and other obligations. And also officials provide travelers with information outlining what is required of them during the isolation or quarantine period. Officials then connect and contact travelers throughout this period to remind them of the requirements. And we have also initiated compliance verification visits by third-party security companies that are now underway. And if a traveler cannot be reached or it seems that they're not complying, they're referred to local law enforcement. And there are fines, Mr. Chair, which range up to 6 months in prison or up to $750,000 as such. So, alors que nous continuons à répondre à la pandémie.
As we continue to respond to the COVID-19 pandemic, we will continue to evaluate the border measures we have in place to ensure they are effective and minimize the introduction of new COVID-19 cases.
Realizing that now is not the time to travel, and the Government of Canada continues to advise against non-essential travel to and from Canada. Thank you, Mr. Chair.
Thank you, Dr. Gocher. And now finally, on behalf of the RCMP, Chief Superintendent Rupa, please.
Hi, thank you very much, Mr. Chair, honorable members. I would just may like to make 2 points. The RCMP remains in a high state of readiness to respond in the context of the ongoing pandemic. And RCMP personnel are continuing their work to uphold public safety and ensure Canadians continue to receive dedicated and professional policing services based on national, provincial, municipal, and Indigenous priorities. The RCMP is working in collaboration with the Public Health Agency of Canada, the Canada Border Services agencies, and other law enforcement partners to ensure compliance with Quarantine Act requirements for border and self-isolation measures. The RCMP is also working closely to support the safety and security of the vaccine rollout. Thank you very much.
Thank you. And with that, we'll commence the 6-minute round. I have Madame Stubbs, then Madame Demoff, Madame Michaud, and then Mr. Harris for the first 6 minutes each, please. Madame Stubbs.
Thanks, Chair. For the Public Health Agency, for Ms. Evans, if she's here at committee last month, you were asked for the data and evidence that was used to develop the hotel quarantine rules. Do you have that now?
Mr. Chair, thank you for the question. And I believe that undertakings from the previous meeting have been handled by my department. So we're pleased to follow up. Thank you.
Okay, so you'll provide that as soon as you can to our committee as well. Have the health or the public safety ministers ever asked for that data and evidence?
Mr. Chair, if I may. Yes. So the information which is being produced as a result of continuous assessment, that continues to be put together. There is very limited information pieces which are available right now because as the travelers come in, we are gathering that information as we go.
Okay, so I guess for Canadians, what we're trying to get to the bottom of is, then would it be safe to say, in fact, there is no complete data or evidence that was in place that then led to the decision, the policy decision for the quarantine facility rules?
So I would start, Mr. Chair, by mentioning that, as we actually started to look at the 2 things, one, the variants of concern and any chance of importation of COVID-19 from the countries which were showing high transmissibility and higher rate of infectivity, this was the right step to do in terms of making sure that we do not introduce any of those variants, which could be either highly transmissible or also could be a potential that they could cause higher death rate. So based on those things, we are very much in that zone where we have to take some protective measures so as to protect the health and safety of Canadians. So one of the aspects which was triggering this was the ability for us to curtail any of the importation of COVID-19 variants.
That whatever data and evidence was gathered in order to then make the decision to establish the hotel quarantine rule will be provided to our committee. Prior to recent reports, did anyone in PHAC know that women were told not to lock their doors and to not tell anyone where they were in the facilities? Was PHAC aware before the public reports?
So PHAC has actually worked with the Hotel Association of Canada, who provide the.
I'm not talking about. I'm not talking about the most recent 3-day quarantine. I'm talking about the alleged assaults that occurred under the federally mandated facilities, not run by the hotels. I'm talking about these instances that occurred where the only role of the hotel was to provide the property. So that is why I have asked, did anyone in PHAC know about these instances before the public reports?
So that's what I'm trying to explain, Mr. Chair, that as such, the hotels have their protocol, and the security and safety of the clientele who is in there is a responsibility with the hotel. They have the door locks, and they have the right kind of monitoring mechanism also. And that's what we rely on in terms of making sure that the clients will be taken care of.
To the RCMP, were enhanced RCMP clearance checks used to vet and certify private security firms and screening officers prior to their access to quarantine facilities or homes of Canadians complying with federal quarantine requirements?
Mr. Chair, that was not an ask of us. We were not involved in anything to do with the hiring of the private security firms to do any of those compliance checks or the work at the government-approved accommodations or the DQFs.
Okay, so is it safe to conclude too then the RCMP wasn't consulted or involved with the planning or the establishment of the quarantine screening officer program?
Mr. Chair, that is correct. The RCMP was not involved in that part of the plan.
Wow.
Thank you.
And what about security standards and risk assessments of the selected quarantine facilities? Was the RCMP consulted or involved with any of that?
Mr. Chair, as far as I know, we were not involved in the selection of any of these sites, either at the DQF or at the government-approved accommodations.
Do you know who does? Do you know who does do the security standards and risk assessments?
I do not, Mr. Chair. That is an aspect that we were not involved with. Thank you.
Are you aware of any more allegations of sexual assault or other criminal behavior in the federally mandated quarantine facilities or at homes? And has the Public Safety Minister asked the RCMP to investigate or get involved following the public reports?
Very briefly, please.
Mr. Chair, of course, there were two very horrible incidences that occurred in non-RCMP areas, so where we are not the police of jurisdiction. Where we are the police of jurisdiction for the designated quarantine facility or the government-approved accommodation in the Vancouver area, we are very much in contact with PHAC and on a daily basis. We do attend those sites. We have had some investigations. Those investigations are ongoing, but they are very minor in nature compared to the two horrific and horrible acts that occurred in other POJs.
Okay, we're going to have to leave it there. Thank you.
Thank you.
Madame Stubbs. Madame Damhoff, 6 minutes, please.
Thank you, Chair, and thank you to all our witnesses for being here today. Dr. Bogosh, I have a question for you. The government's been saying almost for a year not to travel, without exception. And yet we still have people who are traveling and they're looking for exemptions. Then we have these variants start popping up. And they're serious. These variants were extremely serious, and I'm just wondering, what would you say to people who still think that they need to travel for non-essential reasons? But how important is it also that the government be able to adapt and react quickly to change whatever measures they're putting in place in order to keep Canadians safe?
Thank you so much for the question. Yeah, of course, we heard over a year ago, or about a year ago, to avoid all unnecessary travel from the Public Health Agency of Canada. It does not get more clear than that. Avoid all unnecessary travel. Like, it's about as obvious as it gets, yet people still chose to travel. Certainly, the variants of concern got in, and certainly they did escape the measures that were taken in place. I still firmly believe that the 14-day quarantine period cushioned us significantly from importing these. Like, we really did get very good, of course, not perfect protection with that policy. Now, of course, in the context of an unknown threat, which are the variants of concern, to which I can't look anyone in the eye and tell them with a straight face, even now, exactly what they mean. We're still learning a lot about them. It's important to proceed with a precautionary principle, meaning take it seriously, because we don't know how deadly or not these could be. We may as well play it safe. And that, of course, means being able to rapidly adapt your policy to an emerging global health threat. And you certainly need that capacity to be swift and nimble to stay 2 steps ahead of the virus, because we've already seen what happens when you don't.
And that could mean not necessarily having a binder full of data to confirm what you're doing. I mean, I know countries like Australia and New Zealand have had, and those are just 2 examples where they have used hotels for quarantine.
Yeah, well, pardon me. I completely agree. I would imagine there would be no binder full of data, because that data does not either exist or is in the process of being collected, but it would adhere to this, the standard of what other successful nations have done. And it also adheres to the precautionary principle, which many people might remember was written all over the SARS write-ups after the SARS epidemic in 2003, 2004, because that is a smart and careful approach that we can take to protect Canadians. So you don't need binders of data to drive this, because, quite frankly, they don't exist. You adhere to the precautionary principle to protect Canadians.
Thank you, Dr. Bogosh. I have a question, and I'm not sure who the ideal person is at PHAC to answer this, but all of us agree that these sexual violence is unacceptable. It bothers me a great deal to hear the Conservative Party making it a partisan issue somehow, because it's not. We all find it abhorrent, and I think, one of these did not occur in a hotel. It occurred in my community of Oakville, and the Halton Regional Police Service are investigating, as they should be. What is PHAC doing in light of these assaults, as well as in light of comments being made about, that were made about locks and not telling people where these women are staying? What are you doing to respond to those concerns, to ensure that whatever policies in place are adapted to keep people safe when they're in hotels or in quarantine?
Mr. Chair, if I may.
Yes.
So thank you for the question. So one of the things which we have very much mentioned earlier is that there is a certain criteria which the hotels need to fulfill, which includes the security, the care and nurturing, as well as the other components which they really need to provide. And one of them is to make sure that there is proper security in place, and so these events don't happen. It is very unfortunate that thing happened. But also, I want to come back to the point which you mentioned earlier in terms of there are other situations, like when we have contractors who go in and actually do the spot checks. So as a part of the contract with PHAC, all the employees of the security companies who are employed working on this contract must have a security guard license. That is important. A valid police background check, and must sign a non-disclosure agreement. And pursuant to this contract amendment, which we had, they must also receive a reliability status clearance within 90 days of the contract agreement. So these are a few of those things which we are trying to really, kind of focus on, so that these events don't happen at all or have minimized risk of ever happening again by making sure that these things are in place. Thank you.
I only have
30
seconds left.
Yeah.
Have you been in touch with the hotels to make sure that the security requirements are clear in terms of locking doors and those types of requirements?
Absolutely, Mr. Chair. What I want to reiterate is that we work very closely with the Hotel Association of Canada and with a regular communication and reminding them of the guidelines and the procedures which they should have in place so that, and we also do the check-ins to make sure that those things are happening. And that is very much happening in real time.
Thank you.
Thank you.
Madame Michaud, 6 minutes, s'il vous plaît.
You have 6 minutes. Thank you, Chair. Very good. I managed to settle my technical issue, so thank you now to the witnesses for being here. I much appreciate being able to put questions to you. Now, of course, the government brought in this mandatory quarantine, and I'm sure that's because public health felt that this was the most effective way to avoid spreading the virus, that this would be more effective than sending them home for their quarantine. But we have seen that people have found ways to wiggle through to get around the rules, go over through the land borders, for example. Yes, we see 11% more land entries in the last few weeks. That news has been out for a couple of days now. So why not impose the same rules on those coming in through the land borders as those coming in by air? Because surely they could spread the virus just as much as those coming in by air, so why not use the same rules? And I'm not speaking about workers, essential workers. The ministers were mentioning the fact that most of the people coming through the land borders are essential workers. Nevertheless, there are people who are traveling for non-essential purposes coming in through land borders, so why not send them to the hotels as well? I'm not sure who might wish to answer.
It seems like it's equal treatment between the land borders and the air borders. That's probably the thrust of the question.
Mr. Chair.
Bonjour, c'est Denis Vinette va répondre.
No, I was actually going to say I can certainly add. Je peux ajouter, Monsieur le Président.
I can certainly answer, Chair. I can give you a bit of information about this. The rationale behind the difference between the two entry points, it's important to recognize that 93% of people coming over the land borders are not sent into quarantine. Only 7% of people entering by land must go into quarantine and are non-essential travelers. And then we have the new surveillance assured by the testing at the land borders. Right now, we have about 650 or 800 people a day over the land border coming in who are going into quarantine. The number of people coming in, you say it's higher, 11% higher. This is really due to trucking. So that explains that figure. So about half the people coming through at the border are now sent into quarantine compared to what happens by air. The interpreter points out that the sound quality was inadequate. Thank you. It's very good to get a clear answer. Do I have any time left, Chair?
Mr. Vinette's sound quality is not ideal. If you could, I'm open to any suggestions for the interpretation. Maybe is it with respect to the arm of the interpretation? Well, let's proceed and we'll work out sound quality as we go along here.
OK, merci.
Madame Michaud?
Oui, par rapport à la
Yes. So communication that occurred with the different police services, what I understand then is there hasn't been a clear directive put out by ASPC to police of jurisdiction about the fines for people who decide not to respect quarantine, hotels, quarantine, the $850 that someone was very happy to pay rather than going into a hotel quarantine that would have cost $2,000. So is there any specific directive, how much people should be fined, for example? And do we have any figures about the number of fines that have been imposed? We've heard of something like 15, but has everyone who has defied the rules been fined? Hello, I'm Brigitte Diogo, and perhaps I can give you an answer to that. What I can say is that we are working very closely with police of jurisdiction. We have guidelines and information sessions for all police service groups that are working on this and that are applying these measures and that are following up and ensuring compliance to quarantine orders. As for the number of fines or the amount fined, there's no discretion in this matter. $3,000 is the amount set for someone who is not compliant with the order in council. And we could give you more details about the number of fines that have been given out. But since the process has been set up, we're receiving data ongoing about the number of fines, and we could certainly give you this information. That would be much appreciated. So you can tell us that the 15 fines that we know of as of yesterday were $3,000 fines. I can tell you that more than 15 fines have been served so far. There are various provisions of the legislation that lead to different fines if you are non-compliant with them. But all of this, when you really are non-compliant with the order in council itself, it's $3,000. No discretion in this matter. Most of the fines have been of that nature.
Madame Michaud, Mr. Harris, 6 minutes, please.
Thank you, thank you, Chair. And I have a question for Dr. Kosher. You did say that there was an issue with respect to locks, but we talked to Mr. Stewart about that before, and he said there was no mandate by the Public Health Agency that there should be no locks. But I asked whether there was a mandate that there should be locks. You seem to say, on the one hand, this is left up to the hotels, and then you talk about enhanced security. So could you explain exactly how you ensured that the people were safe in hotels?
Thank you, Mr. Chair, for the question. What I'm, explaining is that as a hotel policy, there's always locks on the door. There is not a room which does not have a lock on the door, and that is, the different ways to open the door. But that is a standard in. I
understand that, and I've been in hotels. We've all been in hotels, but we heard that people were told not to lock their doors, or people had non-locked doors. Did you know about this? Did you put a stop to it, or what did you do to fix this problem once you heard about it?
So we have been, as I mentioned earlier, Mr. Chair, we have been working closely with the Hotel Association
of Canada. I understand that, sir. What did you do about the lock situation when you heard that people were in unlocked rooms?
We have given guidance as such to the Hotel Association to provide.
The Hotel Association don't run the hotels, sir. That's a Hotel Association is an industry organization. Did you actually tell the hotels that you had contracted that they must do this, or did you go and inspect them or ensure that there was proper security there?
So, Mr. Chair, again, this is a regular procedure. We work through the Hotel Association.
It's a very simple question, sir. Did you and your organization provide any enhanced security as a result of these concerns that were expressed, or was a situation as usual dealing with an industry association and assuming they followed procedures?
Mr. Chair, I would like to re-emphasize the fact that, yes, we work closely with the Hotel Association, but we also make sure that our presence in those areas and the security which we have on site is actually briefed up of any of these kind of concerns, and that is that takes place as a normal matter of fact as we go forward. As we continue to kind of enhance our approach to that, that is a continuous way of working with the.
So you have security services of your own that are at these quarantine hotels, yes or no?
We have a Public Health Agency of Canada people in there, and we also have the security services over there, which are contracted services.
Contracted service of your own, not the hotels.
Not the hotels.
Very hard to get a straight answer, I'm afraid. I have no concerns. I have no concerns about having a proper protection for particularly the viruses of concern, variants of concern. We've had an outbreak in Newfoundland and Labrador. They runs like wildfire, and we've had community spread for the first time. So I'm very concerned about that, but I'm also very concerned about the safety of individuals. Dr. Kohler, is there any plan to adopt the proposal that Dr. Bogosh said about making sure that all of the, and there appears to be lots of them that are traveling across back and forth the U.S.-Canada border, are going to be given as a priority an expectation that they have a vaccine as soon as possible? Is that part of the plan to protect Canadians?
Thank you, Mr. Chair. And again, I would say that we're working closely with the independent body, which is the NESI, which is the national body on immunization, which actually dictates as to who are the priority groups, working very closely with them to identify if there is a possibility that those who are essential workers crossing are their frontline workers, that they can be prioritized. But this is something which is in the hands of provinces and territories. A lot of work which is going on in terms of making sure that those aspects are brought forward as such.
Well, the government of Canada is responsible for the borders, Doctor, and I understand the provinces are dealing with vaccines, but if the borders are being controlled by Canadian Border Service and the government of Canada, surely a mandate for people who are crossing back and forth all the time, potentially bringing in the variants or COVID-19. There's thousands of them crossing every day in Detroit and Windsor. Essential workers working on one side, living on the other. Is there any thought being given, or any thought being given, or would you be prepared to promote making sure that essential workers that are traveling back and forth on a regular basis be expected to produce a vaccine or be given a vaccine as a part of the border crossing initiatives?
Mr. Chair, what I can say clearly is that these conversations are very live and ongoing. I'm not particularly involved in that component, but these are very much ongoing and alive conversations on that.
Well, perhaps I would, can I urge you to bring it to their attention, Dr. Bogosh's recommendation here this evening, that seems to me to be a very simple and logical extension of the kind of protections that we're talking about here, where we're the quarantine, the hotel quarantine, the 14-day quarantine, only essential workers allowed to come back and forth. Surely we can ask them to have a little extra protection that are going to protect them and protect the rest of us.
So Mr. Harris now knows that was 6 minutes and 1 second. So,
and I ended with a comment, sir, not a question.
Yes. Amazing. With that, we've completed round one. Excuse me. Round two is 5-minute questions. We're starting off with Mr. Kirk, please.
Thank you very much, Mr. Chair, and thanks for all the witnesses for making yourselves available here today. So it's my understanding that the Public Health Agency of Canada issues the exemption letters declaring that an individual performs essential work, yet the CBSA has the ability to overturn or make a determination about whether or not somebody's work is or is not essential. Can the CBSA clarify if their agents are in fact given that authority?
Yeah, I'd be happy to begin and invite my colleague, Mr. Christensen, to jump in as well. I think the first thing I need to make sure that is very clear is that our officers have very little discretion in the actual decision-making or application of the orders in council as they've been drafted, or the Chief Public Health Officer's exemptions that are also in play as it pertains to whether or not individuals get directed into quarantine or not.
So if I could follow up with that, so you're saying there was very little input that the CBSA had in regards to what these exemptions do or do not look like. Is training or guidance provided to officers to ensure that they are equipped to properly make these determinations?
Yeah, absolutely. And I'll ask Mr. Christensen to jump in. I will just add that it's very clear that the decisions that they render is based on the information that's presented to them by the traveler at the time that they arrive. And that is ultimately what leads to the decision by the officer at the port of entry. But Calvin, over to you.
Thanks, just before Mr. Christensen, if you're going to respond again, I'm being told you should raise your boom, Mr. Vinette. Yeah, there we go. Thank you. Go ahead, Mr. Christensen.
Okay, thank you very much. There's a couple of things that we do on any time that the orders in council come out. And we put together information package for our border services officers. We go through it slightly before it's issued with all of our regional operations to walk through what the process is, what the exemptions are, to make sure that everyone is delivering from the same page. And what happens on some occasions, and what we've seen happen, is that when a traveler is coming back into Canada, or when a traveler is coming into Canada for the first time, they aren't necessarily always telling the full and the whole story to the border services officers. And so the border services...
I appreciate that, but I have an example of a constituent got off an airplane with a coworker, virtually the same paperwork. One ended up having to go into a hotel quarantine. One did not, and I think that there's a great deal of concern and confusion, and this led to multiple points of contact, possible COVID transmission because wife was going to pick him up from the airport. So I'm really looking for where the direction comes from to ensure that these rules are applied equitably and clearly and concisely. So is it the Public Health Agency of Canada that gives packages? Am I understanding that to CBSA, and then CBSA is responsible for enforcing it?
What happens is that the order in council is written, and once the order in council is finalized, we go through that order in council and look at the structure of it and what's involved in it. We prepare guidance to give to our officers in the field with the Public Health Agency of Canada to make sure that we're on the right page and taking the right approach to each of those orders in council. And then we issue that out to our field operations slightly in advance. So we do really attempt to make sure that we're as consistent as we possibly can. And these inconsistencies will happen when sometimes the whole story isn't given by one traveler or the other.
So there's an alleged victim that says that her passport was taken away before she was sent to one of these quarantine facilities. Who would have taken that passport, and under what authority?
Mr. Chair, the first I had heard of a passport being taken away was earlier today, so I'm not particularly familiar with that case and the incident that surrounds it.
If that information could be provided to the committee, certainly that would be helpful. And Mr. Chair, if there's time, I would ask the Public Health Agency of Canada, did they ever make a recommendation to either the minister or the deputy minister to make to suggest that the hotel quarantines was a positive step to control the spread of COVID in Canada?
Very briefly, please.
Mr. Chair, if I understand the question correctly, we have been really watching, as I mentioned earlier, the variants of concern and the transmissibility. So the nature of the transmission and the variants prompted us to look at that as a possible measure to reduce the risk of bringing in those or importing that kind of variants.
When was that recommendation first made?
That is unfortunately out of time, and there was usually some rule about communications between senior members of the civil service and their ministers, but regardless, we're out of time. With that, Mr. Iacano, you have 5 minutes, please.
Merci, Monsieur le Président. Et je voudrais aussi remercier tous les intervenants ici présents aujourd'hui.
Thank you, Chair, and I would like to thank everyone here who's come in so that we can get answers to our questions. My first question is for Mr. Kokar, I believe. So what do you think of the RCMP's involvement in enforcing the new Quarantine Act? As have your involvement been as a support group or as an enforcement group?
CMP and the other members of police force, which are the local police jurisdiction, all have been a very good partner with Public Health Agency of Canada in terms of ensuring that there is a compliance which happens. And at the front end where the CBSA officers work with us and the Public Health Agency of Canada quarantine officers are at the airport, for example, there's also the ability for us to mention or to also refer these cases which may be non-compliant to RCMP, which assists us in making sure that they are brought in compliance. Further on, we continue to work in those areas where RCMP has jurisdiction. And maybe my colleague from RCMP can describe how that happens in terms of the partnership, but that's what we actually engage in from the very beginning.
Thank you. Ma prochaine question s'adresse à l'agence.
My next question is for the Canada Border Services Agency. The safety of your employees, either full-time employees or contract employees, at the Canada Border Services Agency is also a topic of interest to me. They're on the first lines. So could you tell us what your protocols are to protect their health and safety? Yes, of course. Thank you for the question, Chair. Starting on the first days, even before the pandemic got really underway, we started supporting our first-line officers. And of course, this goes back to when we first identified the problem coming out of China before it became a pandemic. We worked with Health Canada to ensure that we had all the protocol. We certainly support people's health in all situations, including other prior pandemics. So we use this past data based on current science, using current sanitation measures such as masks and then plexiglass and then proper cleaning. Of course, this remains of highest importance to us, and we worked with our union and our health and safety committees. Thank you. My next question is for the Public Health Agency of Canada. Complaints were made about how people have been treated when they're coming back to Canada. And the PIAC has surely been checking what goes on in the various facilities that are being used. What's the procedure and what do you go looking for when you run checks, when you are carrying out surveillance? And the information that you gather, what do you do with it?
Désolée, j'essaie de...
Very sorry. I was just trying to go online. Thank you for the question. Yes, we do follow up on our checks because the hotels that have been selected based on specific criteria, of course, from the outset, before we even select them, of course, we do visit the sites. And once we have selected a hotel and we have it available via our site, we follow up to ensure that the hotel continues to meet the requirements that we've set. For example, does the hotel continue to do what it told us it was doing when it applied to us? So to make sure that the hotels that have been chosen continue to meet the requirements. Also, to ensure that we keep them on the list or we get them off the list.
With that, it's Madame Michaud, 2.5 minutes, please.
Merci, Monsieur le Président. J'aimerais revenir
Thank you, Chair. I would like to go back to what you said a little earlier, Ms. Joko. When a traveler comes into an airport but refuses to go into mandatory quarantine at the hotel and is charged the $3,000 fined, basically. In an article, Huffington Post, 25th of February last, it seems that PIAC said that if people don't follow the directives, they can be fined $750. And the fine that was given out by the Peel police officers was $850, it seems. So just, is it $3,000? Is it $750? Why was there an $850 fine? Thank you for the question. I can tell you that a number of different cases have come to light since the new measures have come into effect. The $875 that you mentioned is with regard to a specific provision of the legislation, of the law. I don't have the text in front of me now, but in one of those cases, I know that there was an error, actually, in the amount fined. But for anything that is a lack of respect of the order in council, it is necessarily a $3,000 fine that's imposed. I can tell you that our officers out in the field must use their judgment and work on a case-by-case basis to fully understand what a situation involves before they go ahead with a specific fine. Thank you. And yesterday, the press was reporting that some 1,400 and some hotel rooms have been reserved since this mandatory quarantine at hotels has come into effect. So, do we have figures about the number of travelers who've come in by air over this period?
Merci.
Thank you for the question. So our data so far, as of the 8th of March, shows us that 12,971 reservations were made for 17,004 travelers. So some of the reservations were for more than one traveler who was using a single room. So those are our figures.
Thank you. I wonder if Mr. Christensen could answer some questions for me. I'm concerned about the situation of how a person who once is determined that they need to be quarantined, how do they actually get to the hotel, to their room? Is that done by the Canadian Border Services Agency, or you passed over to another quarantine officer? How is that, I guess, enforced, if you will? And like, what measures are there to make sure that they do proceed to the quarantine and not leave the airport on their own?
Mr. Chair, I would take that question. It's a question for the Public Health Agency of Canada. Part of the criteria that hotels were required to meet is to make arrangement for transportation. And when travelers arrive, the Public Health Agency of Canada has officers on the ground to follow up on, to direct passengers, travelers. We also require hotels to provide information to us on check-in and check-outs. And finally, I would say that as part of the requirement to enter Canada, travelers are to provide the quarantine plan through the ArriveCan app or through a web.
We understand that,
process.
but I'm wondering how many people have not made it to the hotel. How many people have either left the airport on their own or somehow got diverted before they got to the hotel they were supposed to stay at? You must have numbers on that.
As has been mentioned previously, the vast majority of travelers have been in compliance with the requirement.
We understand the vast majority, but you said that there was 1,000 hotel rooms that were used and that there was 1,704 travelers involved. I'm asking you another question, which is how many people had been fined for not ending up in the quarantine hotel they were assigned to?
We can provide that information to the committee. We have provided fines to travelers who have refused to go to the hotel once they have landed in those 4 cities, and we can provide that information.
Well, I would ask you to supply that information to the committee, Chair.
Yes, that's an undertaking on the part of the Public Health Agency. Okay. With that, we turn to Mr. Van Popta. 5 minutes, please.
Good. Thank you, Chair. And thank you to all the witnesses for joining us this evening and for sharing your knowledge with us. We heard in earlier testimony this evening, that Canadians have generally been accepting of quarantine restrictions, because we all know that we need to keep ourselves and our fellow citizens healthy. So yeah, I'm not surprised. Of course, we're all law-abiding citizens. And from my knowledge and experience dealing with many constituents in my riding, I would agree that people generally thought that the at-home restrictions were perfectly reasonable. So my question would be to somebody from CBSA, I think probably, or maybe the RCMP, whether you would agree that the home quarantining has been generally accepted and successful. How many lawbreakers did you catch? Maybe to Mr. Vinette.
Thank you. I was having a little trouble coming off of mute there. Thank you. Mr. Chair, the CBSA's role as it pertains to ensuring that there's compliance with the OICs and regulations is first and foremost to receive all arriving travelers, whether it be in air or in land, conduct the questioning, ensure they've met all of the obligations bestowed upon the entry as directed by the OICs, and then ensure that anyone who is not fully compliant is referred over to the Public Health Agency, either to someone on the ground there and then, or through their National Call Support Center, because we have 117 land ports of entry at which anybody may arrive. Prior to the most recent rules, we would direct people to quarantine to the 14 days. We capture everyone's information, where they will be quarantining, how to contact them. That's done in a digital fashion and transmitted over to the Public Health Agency so that they can work with the police partners and themselves to ensure that people are being compliant.
Right. And has there been general compliance from your experience?
I would have to turn to my colleague, Madame Giogo, but I have no information to offer on that question line, regretfully.
Thank you. Yes, Mr. Chair, we have a very high compliance rate on the quarantine requirements.
Good. Well, thank you. And then, comparing ourselves to other countries, in particular the United States, our next door neighbors, our COVID control, if I could call it that, experience is much better, largely on account of the quarantining, at-home quarantining. So, like many Canadians, I'm left wondering what is added with the new mandatory hotel quarantine rules, a new requirement which does not have the broad acceptance, obviously, that the at-home quarantining has had. We've all heard many stories of people trying to skirt the rules, or thinking that the rules are unfair, or coming to their hotel only to find that their hotel room isn't ready, and having left in a waiting room with many, many other travelers. One of my constituents called me and said, I would have felt much safer at home. That would have been a much more successful and safe quarantine. Your opinions on that? Maybe Ms. Diogo.
Thank you, Mr. Chair, for the question. Yes, we continue to assess as we are implementing the measures and make adjustment as necessary. The quarantine hotel is there to ensure that when people arrive, they do the test on arrival. As you know, the international flights are to the 4 cities. They do the test, and they are required to wait for the result of the test before they can continue on their journey.
I understand that. Good. Thank you. I'm going to go over to Dr. Bogosh, and nice to have you here. Nice to see you face to face, sort of. And thank you for your very clear testimony early on. You had said that there are a number of ways that a country like Canada could implement safety rules. You had suggested a travel ban, of course, which is impractical. Testing, which we do, and we would all agree that that's one of the tools. At-home quarantining has been very successful, but now hotel quarantining has been brought into the loop. In earlier testimony, it was unclear to me whether there is clear evidence and data available that says that hotel quarantining is better than at-home quarantining. And I know you talked about the precautionary principle, but am I right that there's no clear evidence available from anywhere in the world that says hotel quarantining is that much better than at home?
Certainly, to my knowledge, that data...
Sorry. Mr. Van Popt has run through his time, but this is a very... It's been a question that keep coming up, so I'm going to exercise a little chair discretion here and ask you to answer it, especially since you've been very patient for the last 2 rounds. So please answer the question.
I'll be brief. Thank you very much. Yeah, to my knowledge, there has not been a head-to-head comparison. And of course, you know, we can talk about data, but we can also talk about public health practice in a time of great uncertainty with potentially dangerous variants of concern circulating, and also precedents set by other countries. So while I can't look you in the eye and tell you with a straight face the degree, the true incremental added safety, I would say that it certainly adheres to fundamental public health principles to add, you know, additional layers of safety where you can to protect yourself from an unknown threat, and then rapidly pivot as you gain and gather that data that would really help inform your next best move.
So it's really an experiment that we're involved in.
Thank you. Yeah. We're going to have to come back on that answer. Mr. Lightbound, 5 minutes, please.
Oui, merci beaucoup, Monsieur le Président. Merci aux témoins.
Thank you. Thank you. Mr. Lightbound here. It's quite clear that the incidents that from Oakville and Montreal are greatly troubling, and it's essential that we find out what really went on. I would like to go back to the investigation being carried out by Public Health Agency of Canada eventually. But meanwhile, the mandatory quarantine in the hotels. It's unfortunate to see Conservatives here this evening suggesting that we be less strict at the borders, and seeing them stand up to these mandatory quarantines that have been imposed, even though we see that the variants are very contagious. We have insufficient information about them at present. In Quebec right now, in elementary school, children are being required to wear masks now. So it's very disturbing to hear anyone suggesting that such policies are guided by, you know, political considerations when we see other nations like Israel, Australia, Qatar, South Korea, Philippines, Great Britain, United Kingdom rather, and New Zealand imposing quarantines in hotels designated by the body politic. I don't see what the problem is. Moreover, we are applying the precautionary measures required. You know, you can't say that someone's putting out fire with too much water. So I would like to hear our doctor, a good doctor here, Mr. Bogosh, based on your expertise, how does this measure fit in with all the other measures that we need to have and keep in place to fight COVID-19, especially at this time when variants are spreading around the globe?
I think it is a very reasonable policy to instill during a period of uncertainty. As you point out, we have to take a precautionary approach. The variants of concern, I would say, you know, a few months ago and to a lesser extent now pose a significant threat. And when I say to a lesser extent, I mean that because we have a greater understanding of what it is they do and the threat that they pose. I would not suggest that we have a full understanding of this, but I think that we can use our understanding of this and certainly our understanding of how the vaccines protect us against the variants of concern and the role of the variants of concern, and we can use that information to help determine what the most appropriate policy is. But in the face of an unknown threat, I think it is very reasonable to take whatever measures you have to protect yourself. And we've seen other countries do that rather successfully, as we've seen, for example, Australia, New Zealand, many countries in Europe, Israel take the same approach. It's a very reasonable approach, and this adheres to fundamental public health principles.
D'où ma surprise de voir les conservateurs s'y opposer là, à toute fin.
Oh, it is so surprising to see the Conservatives questioning this. It's certainly not the sort of position that they will be applauded for in Quebec. Moreover, one of the side effects of the measures has been to convince people not to travel. For a year now, Canadians have been told to forego non-essential travel. Perhaps Mr. Vinet or Ms. Diogo, you could go back over the figures about travel, what the effect of bringing these measures in has been on the number of people traveling. Thank you for the question, Chair. I can say that, yes, we have seen a considerable reduction in number of non-essential travelers coming over the borders. And, of course, the Prime Minister and ministers were encouraging people to return to Canada before this measure came into effect. As of last week, 88% less travelers came over the border, air and land. However, the same number of truckers are crossing the border. So it's really non-essential travelers who have reduced their activities. Thank you, Chair. I still have a bit more time.
Maybe for the Public Health Agency, Mr. Cochard, it was mentioned and it was reported that there was an inquiry led by PHAC into the incidents that have occurred or that have been reported. Where does it stand at this point?
Yeah, unfortunately, he's giving you about 10 seconds to answer the question. Can that be answered very briefly, please? Well, maybe the best thing to do here is to come back on the question in some manner or another, because it is a question into an inquiry into a police investigation. So, with that, we've completed the second round. We're now into the third round. Mr. Motts, 5 minutes, please.
Thank you very much, Chair. My first question is to Dr. Bogosh. I'm just, quite honestly, I'm quite confused as to see your name on this witness list, actually, because the motion was very clear. It was for ministers and for officials who were involved in the hotel quarantine debacle, really. Were you involved in developing this mandatory quarantine, Doc?
I was not.
Okay, thank you. I'm actually, Chair, quite surprised that the Liberal members of this committee are actually avoiding the issue of why we're here, and that is the incidents that occurred and how we can, how they occurred and how we can prevent them from happening again. We all heard in the first, and this is to Dr. Kochar, we heard in the first hour the Minister of Public Safety basically acquiesced his responsibility on the issues of public safety and placed all of the blame at the feet of, for public safety and for security at the feet of PHAC. They basically threw PHAC under the bus. So, PHAC then, when questioned, they said that, well, when it comes to security, the Hotel Association is responsible for security. So the Minister of Public Safety says it's all PHAC's responsibility. And then PHAC says, well, no, it's not ours, really. It actually belongs to the Hotel Association. And then in questioning from Mr. Harris, ADM Kochar, you indicated that, and acknowledged that you actually have government contracted security people at hotels, which means that the government is then in essence, responsible for the safety and security of the required quarantine of people in this required quarantine. Is that your assessment? You confirm that, Dr. Kochar?
Thank you, Mr. Chair, for the question. And I will confirm that what we have is a Government of Canada employees who are the screening officers and quarantine officers, and security personnel who are contracted, who are stationed in there.
Okay, thank you. So that confirms then at the end of the day, it's the Government of Canada who provides the security at these government-required quarantine facilities. So they are responsible for the safety and security of Canadians. Do you recall, Dr. Kochar, did you receive or your department receive any direction from the ministers to change the quarantine policy and conditions and rules after the news of the assaults came out the 24th of February?
Mr. Chair, maybe I can take that question, given it falls under me.
Go ahead.
I would just like to reiterate that the event that we are talking about occurred at a designated quarantine facility that is managed by the Public Health Agency of Canada. It's a very unfortunate incident, and we are fully cooperating with the police.
Okay, so my question, though, directly was, has PHAC really been given direction by the ministers to change the rules, change the conditions, to make sure that, has there been any direction given since this incident occurred on the 24th or after the 24th?
Absolutely. The minister has been very clear that we need to follow up, do our own internal review, and take any corrective measures as necessary.
Then fair enough. It would appear as if then there absolutely was corrective measures that were required to be taken. There's some gaps at the front end. Are you aware, Dr. Kochar, has there any been end date discussed on this mandatory hotel quarantine?
So, Mr. Chair, while we are, as I mentioned earlier, while we are incorporating these changes and continuing to gather data, there hasn't been any specific discussion on any end date. The OIC, however, runs as the course goes on for a specific period of time, but there aren't any active discussions at this point.
All right, thank you.
Mr. Mott, you have about 8 seconds.
Well, actually, I have 30 according to my watch from when I started, but
the only watch that counts here is mine.
Okay, well then,
thank you. Thank you.
I will continue on with my question, being you interrupted me.
Well,
so
no, you won't. With that, I'm turning now to Madame Lambro.
Chair, I've got a point of order, and I wanted to wait until Mr. Motz was done because I didn't want to interrupt him. But I think it needs to be clear that Dr. Bogosh is here because it was in fact part of the motion that was passed. I added him to the name of witnesses because I thought it was important to hear from someone independent. So he's here because it was part of a motion that was passed by the committee. So I just want that to be very clear.
Well, I would like to speak to that, Chair. The motion actually did not include it. It was at a point afterwards, and I would challenge the clerk to find the references to that in our last committee meeting. Yeah. That is not exactly what happened.
Well, we have a point of contention as between the two of you, which is not going to get resolved this evening. With that, Madame Lambro-Poulas.
You're getting better and better at it every single time.
By the end of the year, I'll be able to pronounce your name correctly.
Thank you very much, Chair, and thank you to all of our witnesses for being here to continue answering our questions on this issue. Obviously, what happened in Montreal and in Oakville is completely unacceptable. Nobody thinks that something like that should ever happen, and it's completely unfortunate that it happened. What can the Government of Canada do, and which department would be responsible in order to make sure that nothing like that ever happens again?
So, Mr. Chair, maybe I'll start and have colleagues jump in from the law enforcement point of view. But As was mentioned earlier, we are making sure that all our facilities, they are actually, again, given that complete guidelines, reiterate the point, making sure that the proper procedures are followed, the security is, proper, and a constant check-in. So we also engage in making sure that all of these people who are in these facilities, we actually reach out through phone calls or by other ways, and that also allows us to make sure that they are actually safe and they are in an environment which is overall safe. In reality, what we are trying to do is to actually make sure that we work together with our, with the hotel association, with our, the security which we have in the contracted way, as well as the law enforcement, in terms of making sure that there is nothing which actually increases anyway the risk of anybody being exposed to those, events, events which happened earlier.
Thank you. And I mean, I don't necessarily. I'm sure this is not something that was foreseeable, and I don't think that it necessarily happened, especially with regards to the Montreal incident. I don't think that it happened at the hands of anybody, that was hired by the government, and it was more of another traveler who had gone into a room and assaulted a woman or made her feel threatened and uncomfortable. Do you think that anything could have been done to have prevented it beforehand? I know that you just explained what could be done in the future. Do you think that anything could have been put in place earlier in order to make sure that this kind of an incident didn't occur?
You just put yourself on mute.
Am I audible?
You're fine. I think Madame Lambro put herself on mute, but go ahead.
Okay, so in terms, again, as mentioned earlier, this was an unfortunate event, unforeseeable event. The way how we have our DQFs, they were supposed to be very much in a way a secure place for the travelers to isolate at that point. It's not really something which we had envisioned in any way, shape, or form, but this is a lesson learned for us and a lesson learned in general to make sure that we are more diligent in terms of making sure that these facilities are secure and have an added layer of security to that.
Thank you. And I'm not sure if this question has already been raised and if it's been answered because it's a 3-hour-long meeting and I may have checked out a couple of times, but I just wanted to ask, I had read that people were being told not to mention where they were being located. Is that something that's true, or people are allowed contacting their families and telling them where they are when they're being quarantined? I mean, I imagine there are only a few hotels that are listed that they can even be at. If you can provide any clarity to that.
Bridget,
yes,
would you be?
I would take that question. Thank you. We guests who are at the designated quarantine facility have access to internet. They have access to the phone in the room. We do not prohibit travelers from contacting family and indicating the location. As the government of Canada, we are very much concerned about the privacy and the security of the safety of the travelers at our facilities. And it is true that we do not advertise the location of the hotels, but guests who are at the hotels are not prohibited from disclosing where they are. And in fact, they are aware of where they are.
Thank you. Madame Lambropoulos. We're getting
Thank you.
With that, Madame Michaud, 2.5 minutes, please.
Thank you, Mr. Chair. There was an incident at the Sheraton in Montreal, and the victim said that it took 15 to 20 minutes before security came to help her. And in Taiwan, for having exited their room for 8 seconds, someone got a fine of 3,000 euros. Under the Quarantine Act, the minister can appoint quarantine officers and compliance officers. Are there officers in these hotels, and if so, how many? And are there clear instructions given to hotels to ensure that travelers are in a secure environment? Thank you, Mr. Chair, for the question. The incident that you're referring to took place in a quarantine location that's managed by our agency. I can't provide you the details of the incident, but I can say that on location, there are quarantine officers, there are security agents, there are other partners like the Red Cross. There are compliance officers. There's a lot of staff on location. That's all that I can say regarding the incident. But in that location, there are a lot of people who are present and who would have been able to respond to the incident. But the police has those details. Are there more quarantine officers and compliance officers since the incident? The number of officers in a quarantine location depends on the hotel, depends on the number of people in the hotel at any given time, the configuration of the hotel. But since the incident, there's been an increase in security in these quarantine locations in the 4 cities where people come in from abroad by plane. And in certain cities, there are demonstrations.
Mr. Harris, 2.5 minutes, please. You're on mute, Jack.
Thank you, Chair. The first was one question, Ms. Diogo, regarding the Sherbrooke situation. Is there any policy with respect to locks on doors in that facility?
Yes, there are locks on doors at
And
the
are
facility.
they required to be locked?
Yes,
And people are required to stay in their rooms, are they?
people are required to stay in the room.
Okay, thank you. Thank you for clarifying that. I wonder, Dr. Bogosh, since we have you here and you have your expertise, I'd like you to explore a little further, the idea of essential travelers or essential workers that are traveling regularly across the border. And as has been pointed out, there's been no decrease in the number of them traveling, and they're not subject to a hotel quarantine or any quarantine except that may be regarded by the provinces. So the idea of ensuring that a vaccine might be either mandated by the government of Canada or supplied by the government of Canada, is that something that you would want to expound on a little bit? Because it seems to me that this is a weak link in our system that could be easily fixed.
Yeah, I thank you for the question. I would completely agree with you. We certainly have tightened up the non-essential travel and the risk that poses in importing COVID-19 and variants of concern into Canada. But of course, there's essential travel. This is low-hanging fruit. We certainly could provide vaccination to the thousands and thousands and thousands of essential travelers that come over our border every day. And it would just reduce the risk of importing variants of concern in COVID-19, especially in a time when most of us are not yet vaccinated. Of course, our border policy will change with time, commensurate with our vaccination and our protection as a country. But currently, that is a weak spot.
And this is something, I mean, there's been some suggestion that this is up to the provinces, but surely the government of Canada, as a quarantine rules, could make that a condition of entry, and presumably the federal government could provide that service directly itself, if need be.
I agree.
Thank you. I have 8 seconds left, but I'll leave that back to the chair to use as you see fit.
Thank you. I don't propose to give it to Mr. Motz, though. Thank you. Mr. Kara is Mr. Kirk is 5 minutes, and Madame Kara, are you for the next 5 minutes for the Liberals?
Yes, Chair.
Okay, good. Thank you, Mr. Kirk.
Okay, I'll hand it over to Ms. Stubbs to start my time.
Thanks, Damien. Thanks, Chair. So now that we finally seem to have established that it's PHAC who is responsible for running the facilities in which the instances occurred, about which we are all here meeting today, then can PHAC please clarify La Presse reports that, quote, residents are not allowed to use the security locks inside the rooms, and in stairs it has been removed altogether. Quick, so we're not going to count the pauses against the time, right? Yes, please, just some clarity.
Mr. Chair, I just wanted to reconfirm again that there are locks on the doors in these facilities.
Right. So what about before? I'm talking about the La Presse report that says exactly what I just said. So what about before?
There have always been locks on the doors.
So you're saying
this
is a false claim reported in La Presse?
I am not. I can only tell you what I know about our practices in the facilities that we run, and there are locks on the doors.
Do you have other reports of either alleged assaults or any other criminal behavior within the facilities?
Since the beginning of the pandemic, there have been close to 6,000 people who have gone through our facilities, and this is the first incident of this kind, and which we regret completely.
I just have another question. 4 days after the hotel quarantine rules started, a public health employee at an airport told a family to go home because all the hotels were booked. So I just wonder if you know why that would have happened, who would have decided, how many other times it's happened, and I don't know how Canadians are just supposed to have confidence in the program if home quarantine was clearly sufficient in that case, according to the public health employee at the airport, just because the hotels were all booked.
When someone arrives and they don't have a hotel room pre-booked as required by the regulation, there are two things that can happen. They can be asked to book a room on arrival, and opportunities are provided to do that, or the person is sent to a designated quarantine facility.
This family was sent home, but okay.
Okay, thanks very much. I'll take about the next 2 minutes. Dr. Co-Chair, you mentioned these incredibly tragic instances as unforeseeable events and lessons learned, and I think that language is very, very troubling. So I'm curious if you can provide any, briefly, because there's a couple questions I want to get through, about any inspections that would have been done prior to Canadians being told to go to these facilities.
Thank you, Mr. Chair, for the question. And so my colleague Bridget already mentioned that before these DQFs, or designated quarantine facilities, are authorized to have we have inspections which are happening. So it is an on-site inspection, and based on that, those are approved. Okay. So that is one of the clear guidelines which we have in place.
Okay, thank you very much for that. To the same question of the Public Health Agency of Canada, were inspections completed in these facilities prior to Canadians being forced to quarantine in them?
So just to reiterate, hotels were invited to apply based on a set of criteria.
I understand that. It's so really a yes or no question. Did the Public Health Agency of Canada inspect these facilities prior to Canadians being forced to quarantine in them?
Yes, the Public Health Agency did a site visit prior to designated these hotels on our list.
Okay, thank you very much. So final question, and this is more. I'm hoping you'll be able to provide information because there was certainly some ambiguity from the minister about if Canadians are informed of their rights and some various things. Would the Public Health Agency of Canada and CBSA be able to provide copies to the committee of any literature that is provided to Canadians when they are either going across the border, number one, and two, when they are sent into these facilities? I'd certainly like to see the copies of the literature in both official languages, please.
So, Mr. Chair, that information can be provided. There's a welcome kit which is provided, so we can provide that from our side in terms of that. And Denis, if you want to add from the border side, anything.
And also, if I could ask, especially from the CBSA, any training material and guidance that is given to officers, if that could also be provided as evidence to the committee, that would be very helpful as we study this very, very serious issue. Thanks.
So you still want an answer from Mr. Bennett, I assume? Mr. Bennett?
Yes, thank you. Real quickly, I can say that we do have handouts that we give to every arriving traveler that informs them of their requirements as it pertains to whether being in quarantine exempt, also a different form for symptomatic, asymptomatic. And we'd be pleased to look at the materials we've put together and issued to our front lines for the committee.
Thank you, Mr. Kurek. Madame Kara, 5 minutes, please. And we'll regard, the clerk will regard those undertakings as undertakings to the committee. 5 minutes, please.
Thank you, Mr. Chair. Mr. Chair, I'll be sharing my time with my colleague, Ms. Damoth, as well. But I'll start. First and foremost, I just want to, on behalf of all my constituents, thank all the officials and Dr. Bogosh for being here and the incredible work that you guys have been doing for the last year or so in the midst of this pandemic. I do want to talk a bit about some of the concerns and complaints that I've heard directly from some of my constituents. I represent a riding in Brampton West, and certainly there have been people that have traveled and have raised concerns regarding delays in bookings and difficulty in getting meals or water in a timely manner, and some concerns regarding the public health measures not being followed or enforced, which I know a lot of them are legitimate, but I also know there is a lot of misinformation out there. I know this is a new territory for everyone. We're working together with so many different agencies, different jurisdictions, with actors such as the Hotel Association and even third-party contractors. Can you, and my questions to PHAC, can you talk a bit about how these concerns are being addressed so that Canadians can have confidence and that their concerns are being taken seriously?
Mr. Chair, if I may, so thank you for the question. So in reality, as the program was rolled out, there was, there were some times an overwhelming of the hotels, and in reality, what happened was that there was at times a little bit of a wait in between the time that the people got into their rooms. That has been a focus of our attention, as I mentioned earlier, for us to work with the Hotel Association of Canada to make sure that these things don't happen. Again, providing them with food proper and at the proper time, as well as making sure that all the requirements which the hotels are supposed to provide to the incoming guests, they are actually taken care of. And as I mentioned earlier, we also do spot checks. We do the calls and contact with the clients who are in the hotels to make sure that the things are in proper shape. So we continue to work with the hotels. We continue to work with the incoming passengers by giving them the welcome kit and all the numbers. If they have any issues, they can connect with the proper contact, and that's what we have been trying to do. And overall, at this point, we see that the hotels have been able to get the the clients in a spot where we don't hear any more of those complaints. So those are the things which we have tried to put in place so that this can be a successful program for the people who are actually going into these government approved accommodations.
Thank you. Ms. Damoff?
Thank you so much. Dr. Bogosh, you're one of the most recognized and respected doctors in the country. You've been guiding us through the pandemic from the beginning and providing Canadians with advice they can trust. And I'd like to give you the opportunity to answer the question that was put to you by one of the Conservatives, whether or not the quarantine policy is actually an experiment on the Canadian public.
Oh, thank you for that opportunity. I don't think it's an experiment at all. I think this is what you do in the face of an unknown threat. This is a very reasonable and well-trodden path from a public health standpoint. And of course, it means you learn with time and you pivot when you have appropriate data to pivot. But I don't think it's fair to suggest that anyone would have data at their fingertips to guide an initial decision. And that's why you're guided by the precautionary principle. And we've learned that from SARS as well. I mean, this is, again, a well-trodden path in public health world. So, of course, no one's suggesting that an approach like taking these quarantine hotels is a long-term strategy. As you learn more, as the data gathers, you gather evidence to pivot from that, you can. But I think it was not an unreasonable recommendation, especially with the emergence of the variants of concern and the certain unknown threat that posed at the time.
Thank you very much. I think I've only got about 8 seconds left, Chair,
Yeah.
so I'll end it there.
Colleagues, that completes the third round. We have, and I have to be guided by the clerk here, how many minutes left in the 2-hour time slot that's been set aside. Is it the wish to go back to a round one and complete the time allotted?
How much time is that, Chair?
Well, we have 15 minutes left.
So why don't we divide up the time slots accordingly? So if originally it was 6, make it 4.
Just 4 minutes for each party? Is that good? Does that make everybody happy? Well, I won't go that far.
I think we can default to the first round style. I think there's precedent for that.
Yeah, but then I'm going beyond the time because first is 20 minutes. So I'm going to just simply go to 4 minutes, and because we're going to make more we talk about it, the less time we'll have. So with that, Conservative 4 minutes. Who is going to be up?
I think I am, Mr. Chair.
Okay, Mr. Popka, you have 4 minutes.
Thank you again. So I guess my question is for one of the officials. When did planning for hotel quarantining start? We're about a year into the pandemic now. And the rules were implemented a couple of weeks ago, and it all seemed to have been done very much in a rush, at least from the casual observer. When did the planning actually start?
Mr. Chair, if I can start, and I'll invite colleagues also to pitch in. In reality, what we have been seeing over a time is that as COVID-19 progressed, we also came across one of the bigger threats, which was the COVID-19 variants. And those variants were really of concern because of increased transmissibility, could cause increased death. And also at that time, and still we are gathering information about what would happen in terms of our testing, in terms of our ability to actually have the medical countermeasures onto that. So the gradual approach was, first of all, Mr. Chair, the flights from UK were actually stopped. And at that point, this was the first time when we heard that there was a UK variant. Over time, when we started to look around, there were experiences of other countries like Australia and New Zealand. We were informed from the results from the pilot projects that we have been doing at various airports, for example, Alberta, where, there were some data to say that there are people coming in with infectivity. So that kind of is a prompt for us to look at it. What more could we do to stop the importation of COVID-19 and specifically stop the importation of the COVID variants? So that's the frame with which we were working.
Okay, no, fair enough. So it was really the introduction of variants into the equation that caused us to want to look at yet another tool, hotel quarantining in this case. Now, fair enough. So when did other countries start hotel quarantining? Do you know?
Go ahead, Bridget.
Yes. So the hotel, there are different ways when we talk about hotel quarantining. When we look at Australia or UK, they are using the hotel for the entire period of quarantine. And in Canada, we had prefer the people quarantining at home as being for the 14 days being the best situation for the quarantine. However, with the variants and how to prevent the potential spread of those variants led us to examine the quarantine hotel for a short period of time with the introduction of the testing on arrival.
Okay, good. So I hesitate to use the word experiment because that's been, Dr. Bogosh has corrected that. But we are testing new evidence, right? We're exploring. I don't want to use the word experiment, but we are looking into new ways, whether there are additional tools that can help us keep Canadians safe. Is that right?
Dr. Bogosh?
Yeah, I mean, I think that's a fair assessment, and there's lots of right approaches to this issue as well.
How will we know? How will we know when we can stop this program? Will we know that before there's herd immunity from vaccines or afterwards?
Very briefly, please.
Yeah, so we will. It's going to be an arbitrary decision on when this program can be stopped. There's no hard and fast rule. I think you can look at the data of the degree of protection that the quarantine hotels have provided. And you can certainly look at the degree of immunity in the population. You can look at travel patterns. There's a lot of metrics that you can use. And ultimately, it'll be a value judgment, hopefully driven by data.
Okay, thank you, Mr. Van Popta. Does Emmanuela's cat want to ask a question? Yeah. Okay, it's the liberal question. Mr. Lightbaum.
Oui, merci, Monsieur le Président. Je pense pas que j'en aurai.
Thank you, Chair. I don't think I will be able to use all 4 minutes, but I do have one question that I haven't had a chance to ask. Didn't get it in at the end of my last round. It's for Mr. Cochard, and I'm really sorry if I'm mispronouncing your name. But my question is about the inquiry that's been announced the 24th of February, announced by PHAC, into the incidents in Montreal and Oakville. So where is that inquiry? Where is it at? How much is it advanced? I can take the question. What I'm able to tell you is that our security service at the PHAC has been able to carry out internal studies to see what we might have been able to learn from this and what we should do going forward. And this report is now being drawn up. Some of the measures have nevertheless been adopted immediately. We have strengthened security at some of the entrances to the hotel, for example. That's the end of my question. I don't need more time. However, given that I have the floor, and I will, by the way, recognize or give the floor to my colleague Emmanuel, but I just do want to applaud the work of all of you, and I would like to thank you for all Canadians. I won't take any further time. Thank you, Joelle.
Going forward, what does the future look like for travel and for Canadians going forward?
She was a little faint there. The question is, what do you see as the future for Canadians traveling? And
what recommendations do you have
okay.
going forward?
Is that for me?
Yes.
Oh, this is going to evolve with time. I think we will certainly reach a period of time where we can travel freely like we did before. I certainly foresee vaccine passports in the future, whether we like it or not, however we debate it. This is probably going to be a significant portion of travel, be it in Canada or elsewhere in the world. I think that will be a significant component because COVID-19 is not going anywhere. This is going to be around on planet Earth for years and years to come. But I do see enough of us vaccinated such that we can travel. I see borders restrictions lifting, and I see vaccine passports in our future.
Thank you. That's it for me.
Okay. Madame Michaud, 4 minutes, s'il vous plaît.
4 minutes, Madame Michaud. Thank you, Chair. I have a couple of questions about travel exemptions. Certain things have been reported by our constituents. For example, if you're a foreigner or a permanent resident or a Canadian citizen going overseas or leaving the country and you want to help a dying family member, for example, you can fill out a form and you can be exempt of the mandatory hotel quarantine procedures. But if you are a Canadian and you want to take care of someone outside of Canada and you want to come home afterwards, then you must go to the hotel. So this doesn't seem logical to me. So I'd like to understand what legitimates this. I'm happy to pick up on this question. Yes, this is something that has been brought to our attention, and we are examining it now. So you're examining the possibility of providing for more exemptions, more types of exemption, because the government did on the 24th of February make that list public, and there were many questions put by constituents as to whether they could be benefit from an exemption. There weren't necessarily any clear answers, and the email address given to submit your questions, well, it took a long time for anyone to get any answers. It was like a case-by-case basis. So will you be publishing shortly a list of the exemptions that have been agreed to? Because there's so many situations of people trying to get together with family members would like exemptions. And, well, in extreme situations, of course, it's quite normal that the mandatory hotel quarantine be mandatory for as many Canadians as possible. For people who really do have valid reasons to be traveling, is there a way to accommodate them? What I can tell you is that every time we publish a new version of the order in council, we do, of course, receive many comments on it. In the current case, the question you've brought up here is certainly a question that has been put to us through the messaging that we receive. So we are looking into it, that question and other questions as well. I can't, of course, tell you right now what the final decisions will be, but we're certainly aware of the situation you've brought up, and we are examining it. All right. I understand that if people do have concerns, they can submit them so that you could think them over. Yes, you did mention an email address that allows people to submit their questions. This is an email address that we refer to regularly and that we examine regularly to pick up on all the questions coming in to us. And this helps us see how to proceed and what our decisions can be, whether it's a regulation-based, a rule-based response, or something else. Thank you very much. Much appreciated. I'd like to go back to the situation that took place in Oakville, the incident. I would like to know what directives are given to agents, either police officers or quarantine officers or screening officers, when people refuse to comply. I know that verbal violence, sexual assault are certainly not part of what you're training anyone to carry out, but perhaps you could tell us what people are trained for and how are your officers supposed to interact with people who refuse to follow the orders. Yes, indeed. Well, the officers are trained. We have a set of training modules that they must take, and they must succeed on an exam that we give them at the end. And the Public Health Agency of Canada has very clear orders, very strictly applied orders about how they are to behave. For example, the officer cannot go into a private home.
Mr. Harris, the final formats, you can share 4 minutes. You can share it with Emmanuel as cat.
Thank you, Chair. Mr. Christensen, you said earlier, I think, give us the clearest indication that there was very little discretion on the part of the CBSA officers on admissions, and that you have actually training materials that you developed from the Order in Council with the descriptions as to how they ought to be applied. I wonder, could you undertake to make available those training materials to the committee, please? That would give us an explanation as to how that interpretation is being laid out for the border officers. I think that would be most helpful to members of Parliament for sure, and certainly members of this committee in offering advice to people because we're asked for it all the time as to whether or not they may or may not be in compliance with the essential worker exception.
Absolutely, Mr. Chair. This is very similar to the request that was made for information before. What we do is we send out field guidance in a format that's, depending on which OIC we're dealing with, et cetera. It could be 10 pages long, could be 14 pages long. And that's the guidance that we have. So we will definitely make that available, and it's available in both official languages.
That would be wonderful. Thank you very much. I have a question for PHAC in terms of another aspect of people having difficulty getting entrance to Canada for compassionate reasons. We know that there's an exemption, compassionate exemption for people attending funerals and also for trying to see a loved one who may be in palliative care or in close to death, although sometimes that the approvals haven't come early enough. I guess could you confirm that, Mr. Dr. Kosher, and would you also, is there a possibility of having a compassionate exemption for international adoptions? We've had requests in our office, and I know others have as well, where there's a situation where bringing a child into the country from a traumatic situation and not being able to actually quarantine at home with the child being brought into the country. Is that something that PHSC is prepared to consider as well?
Thank you, Mr. Chair. Maybe I'll turn to Bridget on what is the current thing, but certainly we continue to look at opportunities where we can assist in any way, shape, or form. But Bridget, do you have any specific on that adoption piece?
Yes, as I would say, we are aware of this question as well. So there is a number of questions that have been raised that we are continue to examine, including the one that you just raised. Yes.
So that's something that is under consideration right now?
Yes, and a number of a long list of other issues. Yes.
And could you describe some of the other possibilities for compassionate grounds? We have, a lot of people think that the non-essential travelers are people who are off vacationing and like some of the politicians we've heard about or other people doing vacationing coming back. But we do have circumstances where people who have been away from the country for a year or two, and it's their time to come back after finishing studies or whatever. And this additional expense is a terrible burden to many people in those circumstances. Is that something that there's any exemptions for? They're not workers returning. These are Canadians coming home.
Very briefly, please.
Yes, as I mentioned, when we issue these orders in council, situation comes to light that we must examine, and so we are doing that. I would just finish by saying that the concern that we have is about the variants, and it's not. It's really about the international movement that is of a concern, and so we would examine those questions and see how the risk can continue to be mitigated. Thank you.
Thank you, Mr. Harris. And on behalf of the committee, I wish to thank the witnesses and the staff for their patience and their service to our country in this very difficult time. We are all struggling together. With that, that completes our time, and I'm adjourning this meeting. So thank you again to everyone.
Thank you.